stream in approximately 1 minute.
Thank you, Mr. Rozier.
Ladies and gentlemen, we will begin video recording in about 10 seconds. Check your outfits, check your background, make sure everything is squared away and good to go. I'll begin video recording in 5, 4, 3, 2, 1.
Thank you, Mr. Rozier. Can you hear me okay?
Yes, sir, loud and clear.
Thank you. Good evening, everyone. Thank you for being here this evening. We're going to get going here shortly.
Mr. President, would you like me to go ahead and take roll?
Go for it, sir.
All right, I'll begin with the board. Jason Burdine.
Here.
Allison Drew. Allison Drew. All right, Addie Helliger.
Here.
Grail James.
Here.
Jim Rice.
Here.
Dave Rosenthal.
Here.
And Kristen Tossan.
Here.
Staff, Deanna Saavedra.
I'm here, Dr. Dupree. Thank you.
Brian Gwynn.
I'm here, Dr. Dupree.
Anthony Indelicato.
This is Anthony. I'm present.
Beth Martinez.
I'm here.
Oscar Perez.
Here.
Long Pham.
I'm here, Dr. Dupree.
David Ryder.
I'm here, Dr. Dupree.
Joe Rodriguez.
This is Joe, Dr. Dupree. I'm here.
Robert Scamardo.
Yes, sir. This is Rob. I'm here.
Veronica Sofer.
Veronica Sofer here.
And Gwen Touche.
This is Gwen. I'm here.
All right, and board counsel Rick Morris.
I'm here.
I'm going to go back and recapture Allison Drew. Are you present?
Yes, I'm here.
Very good. All are present and accounted for, Mr. President.
Thank you, Dr. Dupree. Once again, welcome to the meeting this evening, everyone. It is 6:01 p.m. and this meeting is hereby called to order. We have the presence of a quorum attending on a video conference. Notice of this meeting has been posted online for at least 72 hours. On March 16th, 2020, Governor Greg Abbott granted a request by Attorney General Ken Paxton to temporarily suspend a limited number of open meeting laws to the extent necessary to allow telephonic or video conference meetings in response to the coronavirus COVID-19. In accordance with those suspended rules, Fort Bend ISD certifies the following. Although members of the board are not gathered in a central physical location, we do have a quorum in attendance at this meeting by video conference. This meeting is being held by video conference because the convening at one location of a quorum of the governmental body is not appropriate during the COVID-19 public health emergency. Based on current guidelines from federal, state, and county authorities concerning large gatherings and social distancing during the COVID-19 public health emergency, there is no established location for an audience to observe the meeting. However, the live meeting is audible and accessible through a YouTube link that was timely and appropriately provided to the public and media as part of the meeting posting through a news release and via the district website. As we would at any in-person meeting, members of the public who have followed the standard instructions for registering to speak during the public comment portion will be allowed 3 minutes to speak. All other meeting procedures will adhere to the board adopted procedures to the extent practicable. An audio and video recording of this meeting is being made and will be available to the public on the district's website. First on our agenda this evening are our pledges of allegiance. Please stand for our Pledge of Allegiance and our Texas pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please remain standing for the Texas anthem. Honor the Texas flag. I pledge allegiance to thee, one state under God, one and indivisible. Please remain standing for a silent invocation. Please be seated. All right. Next on our agenda this evening, our recognitions. Looks like we have quite a few this evening, Mrs. Sofer. You want to go ahead and lead us from this point?
Thank you. Yes. We'll get that PowerPoint presentation up for you, and we will start with our Texas History Day contest. So as soon as that's up, we'll go through our list and recognize our outstanding students and staff that we had to recognize this evening.
Thank you.
Okay, very good. We're going to go ahead and start with Sartarsha Middle School. Again, some outstanding students that participated in the virtual Texas History Day contest. From Sartarsha, we have Dean Marino, THD Outstanding Regional Project Award, Junior Individual Performance. We have Aryun Bora, NHD Special Prize for Maritime History. Angie Tong, Annie Tong, and Felicia Raval, World War II and the Pacific Award, and second place in the junior group documentary. Rowan Daria, first place, junior paper category. Trisha Bocha and Anshini Kele, second place in the group performance. So congratulations to that group of Sartarsha Middle School. We have Austin High School represented with Tracy Way, third place, senior individual website category. And then from Clements High School, we have Nora Ramey, third place, senior individual documentary. And then we'd also like to recognize Allie Mueller from Fort Settlement Middle School for creating the winning THS t-shirt designed for the state competition. So great job to her. Next, we're going to move on to two outstanding students from Clements High School who placed in the top 3 for public forum debate category at the Texas Forensic Association state meet. We have Michael Wang, second place speaker, and Wallace Chin, third place speaker. And I'd also like to mention that Clements High School received the Laney Naglin Award in recognition of earning 422 cumulative qualifications to date, the most of any 2020 contending school. So outstanding job by that group of students. And all 75 Fort Bend students participated in this competition, so good job. Next up, we have Dulles High School. The academic decathlon team won their 5th large school state championship. This team won 36 event medals, 6 individual overall medals, and first place super quiz team, as well as first place large school team in the state of Texas. Now, I'd like to note that each team member won a $1,250 scholarship, and combined, they took home a total of $18,500 in scholarships. So good job to our Dulles High School academic decathlon students. We have Lainey Hafar, who won 8 event medals, Catherine Fong, 4 event medals, Robert Yang, 5 medals, Abigail Deltz, 4 medals, Jeffrey Jiang with 4 medals, Johan John also won 4, Victoria Brewer, 3 event medals, Chinaza Chinozagam with 2 event medals, Me Mac, 2 medals, and our outstanding coaches that work with these students, Kelsey Halfin and Andrew Hartman. Thank you for all your work helping our students be successful. Next, we're going to recognize Hightower High School boys basketball team. They had a historic run to the state championship, course, due to the pandemic, the Hurricanes were unable to finish out the season as the tournament was canceled just a few short hours before the tip-off. But they finished their season with a 33-5 record. So congratulations to our basketball team. I'd like to recognize our team members, Xavier Powell, Christopher O'Neill, Javon Butler, Ja'Cory Chapman, Chris Harris, Cameron Collins, Bryce Griggs, Aaron Bland, Markel James, Nicholas Hale, Joshua Porter, Javon Stovall, Joe Robertsons, and then our managers, we have Kaylee Knowles, Janie Woods, Kiara Stovall, and Tony Jones Jr., and a big thanks to our trainers, Amy Marotta, Neely LeBlanc, David Baronis, and a huge thanks to the outstanding leadership, our head coach, Stephen Woods, and the assistant coaches, Kevin Fisher, Troy Williams, Vasquez Haynes, Bryce Beal, and Samuel Ward. Good job to our Hurricanes. Next, we have recognition for Grace Park. She's an 8th grade student from Fort Settlement Middle School. She received the Junior High School Grand Championship at the Houston Rodeo Art Contest for her work of art, 3 Points of View, which you see here on the screen. Her artwork sold for $25,000, the highest amount of a middle school student. And part of the proceeds will be awarded to Grace, and the rest will go towards scholarships and education for the Houston Rodeo program. I'd also like to note that Grace has been awarded a 4-year scholarship for the Museum of Fine Arts Houston Glassell School of Art for studies in portfolio preparation and studio practice. Amazing work, Grace. Thank you so much. Next, from Missouri City Middle School, we have Mr. Sean Thomas, who's our 7th grade math teacher there. He won the 2020 Sanford Teaching Award for the state of Texas. This national award recognizes and rewards a teacher from each state for being top inspiring educators. Good job to Mr. Thomas in representing Fort Bend so well. Another outstanding staff member we have, Janet Menzie. She's our choir director at Clements High School. She has been selected as one of the 5 finalists for the Region 4 Secondary Teacher of the Year. She's one of 10 Teacher of the Year finalists selected from over 99,000 teachers in our region. The winner will represent Region 4 in the TASA Texas Teacher of the Year program, and that announcement will be in August. So good luck to Ms. Menzie, and we'll be cheering her on from Fort Bend ISD. That concludes our recognition.
Thank you, Ms. Sofer. Congratulations to all the student and staff that was recognized this evening. We're all very, very proud of you, and I really enjoy hearing about all the success that we have as a district and having those out there competing on behalf of our district. So thank you again, Mrs. Sofer. Next on our agenda this evening are our audience items. We have 2 speakers this evening. And before they speak, I have a few statements to read here. The board encourages and welcomes comments and input from our patrons, but we cannot respond, deliberate, or decide regarding any subject that is not included on the posted agenda. Please limit your comments to 3 minutes, and please refrain from mentioning a student or employee's name when voicing a concern or complaint, as board policy provides alternative procedures through the grievance process, GF local or DGBA local, to seek resolution to complaints. The Superintendent's Office, Human Resources, and Administration in general can assist you in finding these procedures online. The following procedures will apply to tonight's audience items. I will read the name of the person registered to speak and share that they have 3 minutes to make their comments. Prior to speaking, the board's recording secretary, Mr. Gary Rozier, will unmute their phone line. Once the speaker starts his or her comments, Mr. Rozier will announce when they have 30 seconds remaining. And once the 3-minute time limit has expired, and whether or not the speaker has concluded his or her comments, Mr. Rozier will mute their phone line. With that being said, may we have Mrs. Glenda McCall make her statement. Go ahead whenever you're ready, Mrs. McCall. Mr. Rozier, it looks like she's still muted. There we go. We can hear you now.
Okay, thanks.
Whenever you start, you'll have 3 minutes, and Mr. Rozier will let you know when you have 30 seconds remaining. Go for it whenever you're ready.
Thank you. Good afternoon, Dr. Dupree, President Burdine, esteemed trustees, and Fort Bend ISD administrators. Thank you for allowing me to speak to you today. My name is Glenda McCall, and I am the president of Fort Bend American Federation of Teachers. We are very pleased that the district has decided to keep students safe by implementing 100% online learning for the first 8 weeks of school. We understand that the online program is very vigorous and robust, and we look forward to being able to encourage students fully and enthusiastically in this learning process. We know that the safeguards are in place to support marginalized students who may not have connectivity, and that there are plans in place to help students who need additional support with gaps that may have been exaggerated by the pandemic. However, we're still receiving many calls from teachers, support staff, and other professional staff who are concerned with the district's insistence to come into campus, especially while our county continues to be under a code red pandemic status. Hospitalizations are almost at capacity, and county officials are encouraging people with high-risk categories to stay at home. There are many teachers who are willing and able to come to campus and serve students in person, and they should be allowed, even encouraged to do so when it's safe and possible. But there are many teachers who have underlying medical conditions or are caring for family members with underlying health conditions and are concerned for their safety and the safety of their family members. There are example after example of people in the community who have brought the illness home to their family members, having contracted the disease at work, causing extreme difficult medical conditions, or even death to themselves or their family members. It's unreasonable for the district to put the lives of their employees in danger when a reasonable alternative is available. Additionally, there are many teachers who, in having to find alternative childcare for their own children, are contemplating taking FMLA, in some cases quitting rather than leave their care for their child in a place that could potentially expose their children to the virus. In fact, many of the teachers I've spoken with would rather take a leave of absence or leave their positions rather than putting themselves or their family members in danger. I am concerned that this will cause a severe shortage of teachers able to teach in a time when there is already a shortage of good teachers. We are asking that, like other districts in this area, such as ALEAF and HISD, that Fort Bend ISD offers
30 seconds remaining.
Support staff and professional staff the option to work at home if they have a medical condition, are concerned about contracting the virus, have family members with medical conditions, or have children who require childcare. This is a decision that each person needs to make individually for themselves and their family, and should not be something the district compels them to choose between their lives and their livelihoods. Thank you.
Thank you for your comments this evening, Mrs. McCall. Our next speaker is Miss Taruni Tanjirala. I hope I got that somewhat right.
Close enough. Yeah, close enough. Thank you.
Thank you for being with us this evening, ma'am. Whenever you're ready, you'll have 3 minutes to speak, and Mr. Rozier will give you a 30-second warning before your time's up. Go ahead and start whenever you're ready.
Okay, thank you. Dear our esteemed Dr. Dupree and Board of Trustees. Hi, my name is Taruni Tanjirala, and I'm working with Shivani Guha and Quinn Maitran. We're recent graduates of Dulles High School with firsthand experience of what it's like to learn in an FBISD classroom. While we are grateful for the education FBISD has equipped us with, we believe that our school district can do better to increase the inclusivity and diversity of its current curriculum. Today, I am speaking on the behalf of more than 300 current and former students from across the district seeking to bring an initiative to diversify school curriculums, starting with the greater Houston area. Our petition, titled Dear FBISD, was emailed to the board on June 30th. It explains the need for an anti-racist curriculum, which we propose would simply add on to our current curriculum, circumventing the need to alter the one accepted by the State Board of Education. Since a more diverse curriculum calls for diverse voices, it is in our students' best interests to have multiple perspectives discussing how to implement this reform. This is why we are requesting swift action on the one request stated in the letter, to call a virtual town hall for FBISD affiliated individuals to discuss solutions about curriculum change. A town hall will give everyone the chance to voice their thoughts, which also serves the fundamental purpose of the initiative, inclusivity. We know education can do wonders to shape students into citizens who are ready to exhibit all the characteristics outlined in FBISD's profile of a graduate, especially being a collaborative citizen. However, with the current state of our nation, where every day is marked by another social protest, we as a community need to take the time to reflect on whether or not we have prepared our students to address current conversations about racial bias. As a recent graduate, I can say that we have not. There is an imminent need for discussions in our classrooms about how century-old biases have manifested into present-day racism. Again, we are not asking for an overhaul of our current curriculum, but rather an accompaniment of much-needed racial perspective, racial bias training, and increased narratives from people of color. This is why we hope that you will take the time to start a dialogue in our district regarding how the content taught in our classrooms can be more inclusive. We can't put inclusivity on hold, not today and not ever. Thank you for your time.
Thank you for speaking this evening, ma'am. We appreciate your comments. Moving along to the next part of our agenda here, that would be our information items, 6A1, which is our update on response to COVID-19 pandemic. Dr. Dupree.
Yes, sir. Good evening, board and guests this evening. We've got quite a few items included in our update for you this evening, so I'm going to get right to it because we do want to move through it quickly. I'm going to do a few slides, and then we have some guests from our medical advisory that we wanted to engage directly with the board this evening to address questions you might have about some of the things going on in our community and how they affect our decisions. But I'm going to begin by just kind of going over the bullet list of talking points that we're going to hit on tonight. First of all, we're going to talk about some of the major concerns that have been expressed over the last week or two. We're going to get into instructional expectations because many parent and staff questions are coming from what online learning is going to look like. We want to talk about social emotional learning because our students are going to need significant support during the coming year. We're also going to talk a few minutes just about operational systems and a proposed school calendar update that is on the agenda for action, proposed action tonight. We also, then at the end, we're just going to wrap up with discussing of next steps. Some of the major concerns that have been on the minds of our staff and community have to do with some of these questions. They want to know, how long will FBISD remain online? Will teachers be required to teach from school? What will synchronous instruction look like? What will parent expectations look like? How much time will be expected? What learning supports and childcare will be provided for working parents and FBISD staff? How will we ensure the fidelity of implementation of online learning? And then finally, will idle staff that are currently not working while the district is online, will they be paid their usual salary? So the first thing I want to tackle has to do with online learning and the decision to begin school 100% online. So at this point in time, we do plan to begin school the first day with all students online with limited exceptions. We do expect students served with special education services will launch with face-to-face instruction based on their ARD decisions. And that's important because that means parents agree and the staff serving the children agree that the students need to be in the classroom. We are going to have just a limited number of staff working on campus, but we think it's important to serve our learners who have the most significant need in a face-to-face model, if at all possible. So while we're on code red, if you will, or red alert in the county, it's going to be very limited, but SPED services will be provided on campus face-to-face. FBISD will remain online at least 4 weeks, and that's very important because we do, based on new guidance we received from the commissioner and TEA last week, if we want to go beyond those 4 weeks, the board is going to have to approve a waiver that we submit for another 4 weeks of online instruction. So the thing that we're working on right now, first of all, is we have a COVID-19 advisory committee. I've generally referred to them as our medical advisory committee, but there are other members on that committee, including psychologists, psychiatrists, as well as specialists, specializing physicians who are, and in the county, I'm Director of Health and Human Services, who are helping to guide our decision making. Many parents are asking me through email or when they see me, what science are you relying on to make these decisions? And my answer is, I'm not relying on any science. I'm relying on experts in the science because that's not my bailiwick. It's not my place to make a call based on my understanding. I've got to make that call in relationship with recommendations from those who are experts in that area. But I want our community to know and our staff that we're working now to develop kind of the guidelines, if you will, the triggers that will determine when we reevaluate our decision. It could be in 2 to 3 weeks so that we're ready to come face to face in 4 or 5 weeks. It could be later, but our goal is to be as transparent as possible by working with leaders in our community who are experts in the field to do, and of course the CDC, TEA, and other experts in that area. We want to be able to publish what our triggers will be that will determine reevaluation, when we would open schools and when we would be face to face. Of course, there'll be multiple layers. So for example, we might realize that when we downgrade from red to orange, that would mean staff returns to work and more students. Or when we get to yellow, that would be a different indicator. But we want to spell all of that out and put it online so that everybody can see. But again, we'll be working with our advisory team that we're going to expand to add a few more members, some parents and things like that in the very near future. It's also important to know that once we are clear to resume face-to-face, we will stage that very carefully. Parents at that time will be provided the opportunity to choose still between online or face-to-face opportunities. We're going to spend the next year there'll be a lot of latitude in decision making for staff and for families as they deal with the education in light of this pandemic. As I mentioned, the TEA guidance issued on Friday allows an additional 4-week extension, and that does have to have an advisory committee that feeds into that as we develop any waiver that would go to the board. And the TEA also requires an approval of a synchronous learning attestation and asynchronous learning plan, which I'll talk about more toward the end of the presentation. Next thing I want to talk about, well, this kind of brings us to our guests that we have with us this evening. Garrett, if you would please close the PowerPoint so they can be more on screen with the board. We have with us this evening Dr. Jackie Mentor, who is a Fort Bend County Director of Health and Human Services. We have Dr. Kabar Rizvanku, a Houston Methodist Sugar Land infectious disease specialist, as well as Dr. Sarfaz Ali, who works with him, Dr. Sapna Singh, a pediatrician in private practice in Sugar Land, as well as Chris Siebenoller, the CEO of Houston Methodist Sugar Land. We've asked all 5 of these individuals to be with us because the board members have raised a number of important questions, and they would like to have a direct interaction with some of the members who are supporting the district. So what I'd like to do, Mr. President, is allow the board members to ask questions they might have of these individuals. And I know they're all prepared to respond to various questions and probably make a few comments as well about their observations about what's happening in our community right now. So, Mr. President, I'll turn it back over to you. When this part of the conversation is complete, I'll resume the presentation.
Thank you, Dr. Dupree. Normally, whenever we have the opportunity to open this up to the board, I save my questions and comments to the end, but I wanted to make a quick statement, and then I had a few quick questions, if I may. So as we prepare for the upcoming school year, I ask for our community's patience. The administration has been hard at work listening to the community, the governor, the TEA, and medical and educational experts. Unfortunately, in this evolving pandemic, the guidance we receive from the state changes almost daily. It's a little bit like trying to hit a moving target, but we have to do our best to plan for the upcoming school year with the understanding that we must ensure to the best of our ability our students and staff safety while still carrying on our mission of educating students. It is likely inevitable that despite our best efforts, our plans will continue to evolve to meet new guidance and changing circumstances. Again, I ask for your patience and understanding as we all do our best to respond in these uncertain times. And with that being said, Dr. Mentor, if I may, do you plan on canceling in-person school in Fort Bend County this fall? And if so, when will you announce this?
Good evening, and thank you so much. Your comments were so in line with everything that we have been saying as well. With a new virus, the novel coronavirus, obviously changes are happening. As you say, daily with TEA, with other guidance, with CDC. We see new guidance all the time. We also see new things in our community, different changes. So as to your question about closing schools personally, the local health authority does have the ability to work with the schools and look at what is going on in the community and give advice about how disease spread would be affected if schools were open. So for sure, that would be a conversation that would be had with every single school district. We know that there's even different levels of disease transmission throughout the region, but right now, we in Fort Bend County, as in the Houston region, are experiencing quite a bit of disease transmission. As a matter of fact, it is uncontrolled. It took us almost 2 months to get to our first 1,000 cases. It took about 6 weeks to get to the next 1,000 and about 3 weeks to get to the next 1,000. In the last week, we logged another 1,000. When you've got uncontrolled spread the way we have right now, it takes a huge effort to put the genie back in the bottle. And currently, we don't see any way of doing that. We've overwhelmed our ability as a public health response team to do that with our contact tracing, with our ability to test and get the results back in time to know what's actually going on in our community. And I know everyone in the community has probably felt some of that, some of those frustrations with the delays. You know, we had them early on because we were staffing up and we kind of got a hold of things, but it was very, very difficult later. So right now, of course, we're looking at all of the information. The fact that we have 4 weeks is very, very helpful. That's time for us, one, to see what's going on, to see what measures we're doing now that will have an effect later. And the reason that's important is with COVID, you won't know the effect of your actions for 2 to 3 weeks afterwards. So having those 4 weeks is extremely helpful in determining what decisions need to be made.
Thank you. I appreciate your response. I just wanted to make the point, although 4 weeks seems like a lot, traditionally in the spring, we're planning for the fall. And we have several very large school districts here in Fort Bend County, as you know, and every hour, every minute counts when it comes to planning for the fall. So I encourage you to please let any and all of us know about these conversations that are being had, because it's crucial for us to do the planning that we need to do to educate our kids. So I know we have lots of trustees with lots of questions, and I'm sure some of them will take my question and expand upon that. So I will go ahead and start with Mrs. Kristen Tossan, and if I have any other questions or comments, I will save those for the end. So Mrs. Tossan, whenever you're ready, please go.
Thank you, Mr. Burdine. I appreciate that. And thank you, Dr. Mentor, and to all the doctors for being here today. I know it was critically important for me to be able to address you guys directly and ask a few questions as we plan for the upcoming fall, especially. What we're balancing, I mean, we have goals and objectives that say we're going to provide an organizational culture that embraces care and respect and safety and inclusion. And we also have to do that in a safe and secure collaborative community. And it's important to us and part of our goals to provide an equitable learning environment that provides access to the curriculum for all students. So as trustees, we're balancing the safety of the students and the staff with the equitable and inclusive learning environments that provides access to the curriculum. And for a lot of students, online learning just doesn't do that. And so just as you guys, some of you are making these really tough decisions, for us, unfortunately, some of this has been politicized, which makes it a little bit more difficult. And in addition to that, I've been doing a lot of research on my own, talking to medical professionals who I know, and there are just opposing views out there even. So it just makes it that much more difficult when we have to make these decisions. But as we balance these factors, at least for me, it's important to receive medical advice directly from the professionals that live and work and lead in our community. And so I really appreciate you being here, and I'm going to go ahead and jump into my questions, and they're not really specifically for any one of you. So whoever would like to raise their hand or unmute themselves and answer them, or Mr. Boudin, however you would like to handle that. I'm just going to start throwing a few questions out there. My first question is in your professional opinions, will opening school in Fort Bend ISD trigger more outbreaks of COVID-19?
Well, so maybe I'm the one that may be able to answer just from the view of being able to look at what we've seen with the contact tracing and some of the clusters and outbreaks that we've seen since probably early June, mid-June, since we've been looking at that. So I'll take a stab at that, and of course anybody else can answer. So what we've been seeing is our clusters are occurring in smaller groups, and that's common with contact tracing. I am a tuberculosis doctor by background, and so contact tracing is just part of the bread and butter of treating tuberculosis and making sure that we don't spread that disease any further. And you all know that with schools, when it occurs in schools. So we've been contact tracing with these outbreaks in certain areas, and we're finding them in smaller groups, family gatherings, birthday parties, family reunions, and then people will go from there and they'll go to work and they'll go other places. And then we have those, we have diseases occur and transmit that way. What I have noticed that I think is a kind of a good indicator of what might happen with schools, K through 12, is what we've seen in the daycares. So as daycares have opened, we've looked at all of the clusters that have occurred in these past probably 4 to 6 weeks. And we have our vulnerable population in the long-term care facilities, and we've seen those outbreaks starting in March and April. Well, actually more so in April and May. But once the daycares opened, immediately we started seeing clusters occur. And currently we have about 32 outbreaks that we have logged in our daycares. And when you have that occur in the daycare, of course, that means that you're going to you're going to need to quarantine that classroom. And so that means we're losing about 10 to 14 days, and that depends on when people are notified of the case. So 10 to 14 days of quarantining for classrooms. Doesn't always mean that the daycare will choose to close the entire facility, but we have 32 that have outbreaks that have had to close classrooms because of that. And then we have at least 5, and I just checked with our chief epidemiologist right before I came on the call, we have at least 5 that have had to close completely because their outbreaks are extensive. And so they've closed, they've sanitized, they've taken care of everything, and then they were able to open back up. And so with that occurring in our daycares, I think that gives us a little bit of indication of what might happen in a K through 12 environment. Certainly, they had plans in place. They have lots of guidance. We work with them on making sure that things are they're doing everything they can to open safely and to take great care safely. Of course, these are tinier and younger kids where it's difficult. But I do think that even with your best efforts, sometimes there's some surprising things that can occur, and that outbreaks may occur in our schools. With the level of disease that we have in our community right now, I think it's pretty much a given that as soon as we get gatherings together, we're going to see that occur. It happened when we opened the county. I'm not sure if there's any business that hasn't had at least somebody's sister's brother's cousin that has been affected at this point.
Okay, so thank you for that response. I guess my follow-up question would be, the outbreaks that you're seeing in the daycares, are the kids getting sick, or the adults getting sick, or is it a combination?
It is a combination.
Okay, so my next question would be, and this is to all of you again. So recently published by the CDC was a study that was done in South Korea, and they were specifically looking at school reopenings. And this is completely outside of my area of expertise, but as I was reading through it, the study seemed to suggest to me that children younger than 10 transmit the virus to others much less often than adults do, while children ages 10 through 19, which would be roughly our 4th through 12th grades here, can contract and spread the virus at least as well as adults do. And I think it also concluded that school closures significantly reduced the rate of COVID-19 among contacts of children. So my question is, have you guys seen this study? Do you have an opinion on it? Does it inform your decision or your opinion of whether or not schools in the United States, or particularly in our area, should be opening?
My name is Kabir. I'm actually one of the ER and critical care doctors here at Houston Methodist. I can give you kind of a gist. I think that there's a lot of information being thrown out there. And outside of things being politicized, it's important to know how to interpret this information, because you really cannot compare South Korea to America, right? Because their response to the COVID-19 pandemic was excellent. And if you look at their numbers, the COVID numbers that they had when they opened up these schools was far lower than where we are right now in Houston. That's one thing to consider, is the positivity rate within the area of which we're talking about. The second thing is they had so much infrastructure invested in managing COVID-19 where we don't have. Their schools had protocols and procedures established, which the American Academy of Pediatrics essentially recommend the same things: social distancing, having measures in place. And so, you have to compare apples with apples. And I think that, we have not, as a country, not done a good job managing this pandemic. And until we can get a hold of the surge and have an exact plan about how to open up these schools, it is not going to be safe. And yes, smaller children are less likely to transmit the disease, and older children are more likely. That makes more sense because, for various reasons. But I think that you cannot compare and contrast South Korea to the States just simply because it's totally different. It was much better managed, and their positivity rate in the public is far, far lower than where we are.
Okay, so thank you for that response. That's helpful. I think at this point, as trustees elected to govern, we are trying to look at studies and try to look at everything we can get our hands on to inform our decision here, because we get the emails on both sides of this. We get opinions in our community on both sides of this. And I know as a trustee, I tend to err on the side as much as possible of giving choice. But in this particular situation, it's so novel and so unique that I want to be sure that I'm making the right decisions for the safety of not just the kids and the staff, but the entire community. So as a follow-up question to that, I saw that the American Pediatric Association put out a recommendation that schools open in the fall. So what is, collectively or individually, what is your view of this recommendation and why?
Well, being the pediatrician, I guess I'll speak to that. Thank y'all for including us in this conversation today. The American Academy of Pediatrics actually put out the statement, and it very, very quickly went back to kind of clarify that there were two huge ideas that needed to be really stressed. The idea of flexibility in terms of speaking of reopening, being able to potentially go from face-to-face to maybe online, and to kind of be able to move within platforms quickly based on what the situation at the time would require. And the most important idea was safely, opening safely. I don't believe that the AAP's statement was something that they wanted to apply as a blanket statement. I don't think that this was intended to be applied with absolutely no consideration for what the situation is locally, because for sure, if you have a county that has 0 cases and is in a very rural area with very limited interaction with other counties that are kind of surging, it may be fine to open those schools, and you may not have the situation of potential outbreaks and spread. But when you're looking at where we are with limited hospital capacity, limited testing capacity right now, I will tell you that for children at a certain age, it is very difficult to find testing facilities simply because the swabs needed are different. You need somebody who can handle swabbing a child, and to not have some of that available, as well as the ability to contact trace and notify people in a timely fashion so that we can actually isolate and quarantine people away from the school setting. Neither of those would probably fit under safely, and definitely in terms of flexibility, that was intended to allow for the discussion about potentially being online for a period of time, or if you were to go face to face and God forbid some outbreak does happen, can you then shift to an online platform? So yes, the statement was intended to help people and guide them. As a pediatrician and as a mom, I want everybody's children back. I want everybody's kids back. But we just cannot do that without knowing that we do it in a way that's safe and that we are equipped to handle the consequences of getting kids back into school, the teachers, the staff, the adults that are going to go into the schools with them, and be able to kind of handle the consequences of what comes of that.
Okay, so thank you for that. So that leads me to a couple of other questions that are maybe follow-ups. One of them is that if Fort Bend ISD were to decide to open schools for any amount of face-to-face learning, what, in your professional opinion, is what protective measures should be taken in classrooms to help prevent the spread?
Mrs. Tossan, you were breaking up a little bit. If you could repeat that last question.
I'm sorry
No
about that. So my question is that if Fort Bend ISD decides to open schools for any amount of face-to-face learning, in your professional opinions, what protective measures should be taken in the school buildings and the classrooms to help prevent the spread of COVID?
Well, I'm sorry. Go ahead, Dr. Mittner. You go ahead.
Okay, so I was just going to say that this advisory team that we have, this advisory group that the superintendent has invited us to be a part of, we've been able to review the documents and the drafts that they put together. And I can honestly say that what I've read, the plans that are already in place are exactly what you're going to want to be able to open safely when the community is ready to open safely. The work that has been done, the experts that have been consulted, the shoe leather, the planning, all of that energy that has gone into creating this document and thinking about ways to make not only the school structure safe, but for the teachers and the students and the families to feel safe. I think that's exactly what you need when the time is right to open the schools.
Okay, so just a follow-up, you say when the community is ready or when the time is right. So I just want to make sure that I understand that the plans we have in place, you guys believe would help us reopen safely, but you just don't believe that can happen at this time. Because I'm trying to differentiate between you think it's not safe for any school to open right now, and then when it is, these are the plans that should be in place, or will these plans allow us to open safely at this time?
I don't think at this time, with the uncontrolled community spread, there's no amount of hand sanitizer, masking up, isolating, social distancing, temperature checks, screening at the front door that's going to prevent a teacher who is asymptomatic, does not know they've been exposed, from coming into a classroom and then potentially developing symptoms 2 to 3 days from now. And now the entire class, and this is kind of the layout that we have to think about, is what is the structure for handling the consequences of these interactions? will the entire class quarantine? Will they all be gone for 14 days? Will every one of her teacher contacts quarantine? If a child is seeing Uncle Joe, what do we do with all the children who've been around that child now? This virus has created a situation of completely no symptoms to on a ventilator dying within 2 days. And yes, the children have been definitely spared of the worst consequences, though we're now starting to see the inflammatory disorder. That's a whole other discussion. But does that make sense in terms of no matter how much you clean and plan for, right now where we are in the community with our prevalence of this infection, I don't know if any of the teachers or the nurse or the staff at the front or the kids in classroom 3A are infected until they get tested or until they get sick.
Yeah, so that makes sense. Thank you for answering that. So that leads me to my next question, which is what criteria should we use to determine when opening school is safe? What should our markers and metrics be in making that decision?
So I think, let me just, it's Kabir again. Just one thing I'd like to say is, I did a walkthrough through Ann Sullivan, and there is so much that needs to be fixed for you guys to be able to open the school. I think that right now in the midst of COVID, our healthcare system had to develop ways to be able to navigate and bring their employees in to take care of patients. I mean, these were monumental changes that we made inside the hospital, and Chris Siebenaler can speak of that. And I think that right now today, the hospital is probably the safest place to be in. And so you can't just, have this laissez-faire plan for these schools, especially when we're a hot pocket of COVID-19 infections. And so a few things. I think that if you want to be scientific about this, we have to go back and see where was the lowest positivity rate in the community. So I think post, after the first wave, when we decided to open up, maybe it was around 3%. I can't remember. Maybe Dr. Minter can add more to that. But I think that should be your goal. And then at that point, once the surge is over, based on the public health and epidemiological information, you can decide to open up school. And I would suggest opening it up very slowly, because there are a lot of system engineering things that need to be restructured. And I think that you, as a educational system, will need extra time to perfect the process of simply bringing children into the school, navigating them around, and bringing them back for pickup. So there's a lot that's on the plate that the process of opening that you guys are going to need to have organized.
This is Chris Siebenaler. If I could add something on to what Dr. Rizvanku just stated. The flow of people throughout an organization, a building, a facility, however you want to look at it, is something that we've had to learn over these past 4 months. And the number of changes we've had to make in a very dynamic way in terms of having to protect our staff, protect our patients. We've, of course, restricted the number of visitors in our facilities, just in order to be able to protect our staff and our patients and our doctors. But I'll tell you what, it's been a learning experience, one that almost on a weekly basis, it seems, we're learning something new about how to cope with the situation. So I would just reiterate that when you look at a facility, the number of things that you have to think about and plan for to make sure that you don't unintentionally allow for spread to occur is really, until you've worked your way through that and almost even done some dry runs, if you will, to see how you move people through. That's one of the things we ended up doing at the hospital on a multiple occasions, was just seeing how you move patients from one location to another. Just something as simple as moving a patient from the emergency department to the radiology department for a chest x-ray or a CAT scan, or moving them into another part of the hospital. You have to think about who you come into contact with, what sort of PPE those people have. So there's just a lot of things you have to think about. And with spread so high, I would be concerned about just more transmission, as Dr. Minter mentioned earlier.
Can I add to something? This is Dr. Ali, infectious disease. We also have to look at the environment. What Kabir and Chris said, that what you see around us, we have to have a certain percentage. And every site that I've seen, every update I've read through, there's a certain percentage that they look at what's the community spread and what is the safest zone to start the school process. We have to come up with that percentage and stick to that percentage and open up in a phased environment that, hey, and run frequently asked questions type of thing, run scenarios by, and have the testing capabilities readily available, that if there is a person that has a fever, that has a concern, you are pick up the phone, and that person could be there in 10 minutes to test that person and get it over with and give you a rapid answer within half an hour, tell you, yes, there is positive, or there's no, it's negative. Because as we move forward, flu's coming on, there's common cold comes on, there's so much other things that you have to worry about. So there is going to be a panic fear just in the environment if you're going to have these kind of fevers. And as Dr. Singh said, we talk about this, a lot of kids, my personal kids, when they go to school, they have sniffles every day. They have runny nose every day. So people are going to be questioning. So to ease people, to ease the parents, to ease everyone, the teachers, the nurses, the test has to be available, as well as percentage in the environment has to be at a very low level.
Okay, so thank you for that. Thank you, all of you, for that. So I have two last questions, and then I'm going to pass to my trustees. And these are two questions. This is where my competing concerns lie. Repeatedly, my fellow trustees and I have been very concerned about our students with disabilities. Our young students as well. It's harder to teach our younger students via online, but our students with disabilities are a major concern for me, because they have to have a lot of interventions and a lot of supports. So my question for you, all of you, is if we, as Dr. Dupree said at the top of the presentation, we want to allow the ARD committees to make the decision of whether or not to educate that student in the classroom versus at home or in some other setting. So my question for you is, I want to make sure that we can open our classrooms up, or our learning centers, or however we provide this, in a way that is safe. Do you have concerns if we open schools or classrooms to a very limited number of students, where we can implement the plans that you guys have reviewed and keep them safe and teachers safe? What are your opinions on that?
So I guess I'll take that one. I would agree with all of my colleagues about you asked about the metrics and about the safety. I think everything needs to be done in a phased way. You mentioned the AAP study that Dr. Singh addressed very well. I remember that in that statement, they said that the goal was in person for every child. Getting to that goal requires flexibility and requires good timing. And I think that's the case for everyone. Dr. Singh may be able to do this a bit more, but in your students with disabilities, those students may also be more vulnerable if they were to get the disease. So we have to balance that as well. With the level of disease that we have and the fact that we have overwhelmed our system to respond, I don't think that time is today. And I don't think that time is any time in the very near future. But I do think that that is one of the considerations that we need to think about when we talk about the phased opening. Who do we want to open for, first, and how? And what does that look like? Because you bring up an excellent point. My daughter is a special ed teacher in the Austin area. And she talked about the challenges of teaching her children in an online platform with parents. So I absolutely understand that. I know that that's a challenge. However, she also talked about the challenge that she had trying to keep them just to not get flu, in the environment that they're in with only 2 students, and how difficult it was in that instance. So I think you have to balance so many things. And right now, the disease level in the community is just too high to be safe.
I would agree with that. I would agree with the special needs students probably being very, very desperately in need of the routine and of the services that the school district provides them. They absolutely, the families are dependent on it. That is one of the biggest complaints I've heard since the schools have closed, is the adjustment, the lack of adjustment for children not being in school, inability to get services that they're very used to having that have been very helpful. But again, as Dr. Minter said, the children who are special needs tend to be in families that I've seen that are very cautious. They are taking every precaution to not go out and get infected. And the question becomes, can you control them, the behaviors of the teachers that would be serving them? And this is a big question even within the healthcare community. Many of the physicians and nurses have not necessarily been infected, especially in the outpatient settings, from their patients, but it's from the activities that they are engaging in outside of their jobs. And we can't, we're talking about freedoms. People are arguing about masks at this point. We can't stop human behavior. As long as you've got people going out and there's uncontrolled spread of the virus, I guess my concern, and this is what I've discussed with a lot of parents who want to take their special needs kids back, is that I don't know how to know that the teacher would not be asymptomatic and a carrier or sick. And this is kind of what happens when so many people are infected at one time, is that you really don't know who has it and you don't know who's going to give it to someone, and the exposure risks are so high. So special needs children, absolutely. And if you create a tiered phased entry into school, you would potentially even then look more to those studies that you were talking about in terms of, do the younger kids transmit? Are they the bigger vectors? And you kind of can stage your way kids back face to face. But I guess my concern right now is, like Dr. Minter said, we don't even know who has it at this point. It's everywhere. It's just so widespread. That's a huge concern. And those special needs children, some of them, they cannot afford to catch this virus, any virus at any point, but this one in particular.
Yeah, so that's having a daughter with Down syndrome and a congenital heart defect. We're very aware in our home the health risks, and we've made the decision for my daughter not to go back to Texas A&M University, but to take online classes. But I also have to recognize that that's the decision that our family made for our daughter based on our, what we thought was best for her. And there are other families who, like you said, their biggest concern is not so much their child getting sick as it is their child losing all of that educational time and opportunity that, as we all know, they don't get back. They just don't. It's not like a typical student. When you have an intellectual disability, it's not like a typical student where you can make up those gaps. It takes years. It doesn't take months. And so it's a tough one to balance. So I appreciate that input about the phased approach. And, it's a tough decision to make, but as a parent, I guess I lean towards letting parents make that call, if at all possible. My last question, and this is the other side of my big concern, is that, which is why I asked the question at the top of my questioning about, do you think that it's going to trigger an outbreak if we open schools? One of my biggest concerns is the capacity of our healthcare system and our healthcare workers. And the reason we shut down in the beginning was not to overwhelm the system. And in our area where we are seeing a spike, what I've seen and what I've read is a lot of mixed data on hospital bed capacity. I've seen stats, going both ways. It's very hard to weed through that. And so I basically wanted to ask you guys, what are the real numbers? What are we facing if an outbreak is triggered by school reopening, even if it's not everyone at once, but maybe a phase type opening? Because one of the things I, as a trustee, have to be aware of is that if we open back up and not just our kids start getting sick and our teachers start getting sick and we overwhelm with COVID, but we're also hurting other community members who have pre-existing conditions and disease and other things that they may need to go to the hospital for. And I want to be mindful of that.
I think I'd like to tackle that one for the group, and please, jump in if someone wants to add something to it. So there is a lot of data out there. A lot of you see on the news. A lot of it you see through social media, and unfortunately, there's a bit of cherry picking that goes on in terms of what gets reported or what gets emphasized, depending on what the media is trying to focus on. I can tell you what's happening in Houston, and what's happening in the greater Houston area and in Fort Bend County is that we are at a point that is extremely uncomfortable for us as healthcare workers. So what does that mean? So if you look at Fort Bend County, there are 270 people roughly who are hospitalized currently in the county today. So when you think about 270 people, you might think, well, that doesn't sound too high. So let me drill it down further into Houston Methodist Sugar Land, where 50% of the patients inpatients we have in our hospital are COVID positive. 50%, roughly 120 patients, 50% of our, let's call it non-obstetrical, non-neonatal nursery patients are COVID positive. So that means medical, surgical, and critical care capacity. So it seems, okay, well, only half of your hospital is full. Well, trust me, the other half of the hospital is full with very, very sick people. And we're dealing with things like head bleeds coming in through the emergency department, patients who are septic, patients coming in with heart attacks. So we're, in addition to dealing with COVID patients, all of our hospitals in the county are also dealing with plenty of non-COVID disease. Remember, disease doesn't take a vacation. It comes to you and it will be treated. And sometimes the longer you put it off, the worse it gets. And so what we're dealing with is half of our patients currently are COVID positive. Now, again, may not sound that serious, but when you continue to drill down that 50% of our patients are COVID positive, we have 2 20-bed critical care units, ICUs, in our hospital. 40 beds total. We have 47 patients who are critical care ICU level patients, plus another 7 or 8, depending on what Dr. Resvanku tells me during this call, that he personally was going to review in the emergency department all afternoon, because we did not have capacity to be able to manage critical care patients. And so what's happened over time is that we've seen a huge increase in what we call general medical types of patients who are COVID positive. That increase over the Houston area has been tremendous, and those patients had been staying for anywhere from 3 to 4 days at a time in the hospital setting. But those patients who actually don't do well with treatment end up staying in the hospital longer and end up deteriorating and going into an ICU. Those patients ultimately end up staying 2, 3, sometimes 4 weeks in the hospital. While we're dealing with those patients who are staying for longer periods of time in an intensive care unit, we continue to see more increases in patients coming in through our hospital emergency departments. And so what ends up happening is it strains your resources beyond what you're technically capable of dealing with on the intensive care side of our business. And so I'd be lying if I didn't say that right now, sitting here, I am not comfortable with the number of resources that we have to take care of intensive care patients. We're dealing with it, but I wouldn't say it's the optimal setting, and that's not something that I think any hospital in the Houston area would tell you, that their intensive care resources are stretched well beyond what they have envisioned. Now, what we'll have to do next is we'll have to pull other staff out of other non-ICU settings to help take care of potentially critical care patients. And this is all part of our mitigation planning and our preparedness plans. So it's not like this was completely unanticipated, but we're having to do things that we've never had to do as a healthcare delivery system, not only in Texas, but I think globally. So I guess I wish the answer to that question, Kristen, was uncomplicated, but unfortunately, it is a complicated answer. And I can tell you that how the critical care doctor or infectious disease doctor or Dr. Minter as an epidemiologist, I'm sure that they would have a little bit different perspective even than what I said, but I can tell you that working on the front lines in a healthcare setting these days is extraordinarily difficult, and it seems at times unrelenting. On average, and I pulled up a few data points, which I have on my other screen over here. And effectively, we've been treating anywhere from 85 to 90 patients a day who come into our emergency department who get tested for COVID. Of those roughly 80 to 90 patients who come in and get tested, 40% of those patients end up being positive. Now, what you hear in the media is that it's roughly 1 in 4 are testing positive. Well, in a hospital emergency department, you're going to see an even higher percentage because these are patients coming to you who are already sick and likely have been dealing with symptoms for many days now and are finally going to the hospital to deal with their symptoms. So when you start working your way through the numbers and you're testing 90 and 40% are testing positive, and then half of the patients that you're testing positive end up being admitted into a hospital setting, the numbers game can get out ahead of you very quickly. And if measures hadn't been taken at the county and at the state level regarding masking, regarding social distancing, et cetera, over the past month, I think we would be in even worse condition than what we are now. So I would say that we are coping with it. We are not out of control. So I don't want anyone thinking we are out of control as a healthcare delivery system. But I can tell you that our resources are absolutely stressed to the max. And I'm confident that my hospital colleagues throughout Fort Bend County would say the same thing. So I guess I just would like Dr. Rizvanku just to weigh in for a moment or two, since, I mean, literally, this is a guy who was standing in our emergency department a couple of hours ago trying to deal with critical care patients for which we have no beds.
Right. So yes, today was a very busy day. We've had about 8 patients in the ER who need ICU level of care and no ICU bed available. And so we have to make decisions about who to move out and who not. And there were definitely a few decisions that made me feel uncomfortable, but we had no choice. And I can give you another story. I still work at Columbia University in New York City. And when New York City was hit hard in March, I was working remotely telemedicine, taking care of these individuals. And I will tell you that when the system gets pushed, what happens is we have to make tough decisions and they will be made. And so for New York, the mortality rate, if you look at the first wave, is far, far higher than what we're doing in Houston. And it's simply because their resources went, with the wave, the resources really just dissipated and vanished very quickly. And I'll tell you specifically for New York Presbyterian, they had, orthopedic residents and urology residents managing ICU patients. And these ICUs were in the operating rooms in the ER, which is far, far below level of care. And specifically to the ER, we were sending patients home with oxygen levels that are below 90% on home oxygen. And I can't even tell you what the EMS people were telling me about the number of people that they responded to that were dead on scene. And so, the tragedy that happened in New York City must not be repeated in Houston. And so we need to take it upon ourselves to tread carefully through this time and make sure that everything that we do is calculated.
Okay, so thank you both. Thank you all for responding to those questions. I can't begin to imagine what you guys have been dealing with, and I want to say thank you for serving our communities, for serving the people in our communities. You guys really are on the front lines, and I personally appreciate you being there. I personally appreciate you taking the time this evening to come and speak to us, and for being so candid in your answers. That's really what we need to be able to make these decisions. So I'm going to pass it to another one of my colleagues.
Thank you, Mrs. Tossan. Mr. Rosenthal.
Thank you, sir. I also like to thank all of you for being here tonight. I want to follow up, Mr. Siebernaller. Thank you for providing those details. I think somebody brought up social media, and I know there was something going around a few weeks ago with some heads of some hospitals saying that that things weren't as serious. It didn't sound like what you were just saying. And so thank you for that clarity. And I certainly appreciate the fact that you don't want to be in the position that you are now. And so I also wanted to bring up that the study from the Association of Pediatrics, and so it's like a 10-page, 12-page thing here that I read through, and I think Dr. Singh and Dr. Minter, I think you represented what it said well. I think if you just read it, so with the above principles in mind, the AAP strongly advocates that all policy considerations for the coming year should start with the goal of having students physically present in school. And I think that is our goal. I would say it's our goal. I don't, obviously we're not starting out that way. One of the things that I picked up from this report, however, was they talked several times about maybe not having to stick to the strict adherence of CDC guidelines, like 6-foot social distancing, especially for younger students. And I wanted to see if Dr. Singh or Dr. Minter, if you could comment on that. What do you think about that?
Can you can clarify? They said that we should not stick to the CDC guidelines.
No, it said that there has to be some type of a balance between or compromise when possible, or when you cannot social distance, use 6 feet apart in a school setting, in a classroom, because it's really hard for us to do that in many of our schools. So it said 3 feet. Don't know what page it is, but I have it highlighted. It said probably the third page. It says 3 feet may approach benefits of 6 feet of space. So again, and they use the term strict adjustments to the strict adherence of CDC guidelines. So again, I just wanted to get your opinion on that, see what your thoughts are.
I mean, to be very frank, I don't think that we have clearly enough data or have had enough experience with any situation where a school would be opened under the current infection rate that we have in our community. And whether they're at 6 feet or 3 feet apart, the question would be posed, if a child in that classroom was positive or the teacher was positive, what do you plan on doing about that? And that's clearly what is going to happen. Now, the nuance of that is, do we think children will be infected if they're at 3 feet or 6 feet apart from one another? And we can have that kind of scientific discussion, which is academic at this point, because we don't really know. We haven't done this before. And as one of the physicians had said earlier, that comparing the countries that we're comparing in these international studies is not necessarily fair. We haven't done necessarily what those countries have done to get this far. But that's the question that has to be asked, is whether they're 3 feet or 6 feet apart, whether you have 5 kids in the room or 25, are we prepared to have the conversation or to react to the consequence of one of those children being positive, the teacher then being positive, and what would your response be? And if the response is we have to quarantine the entire class for 14 days, including the teacher, whether all those kids get sick or not is not even a part of that step of the discussion. The discussion really just has to revolve around, are we prepared to test? Are we prepared to contact trace? And are we prepared to timely notify everybody who could be affected? And we will know if 3 feet or 6 feet is going to make a difference once we actually experiment with that. But I don't think we have enough data at this point to do that. Does that make sense?
Yeah, it's just that seemed to me kind of a theme, throughout a lot of the discussion in this report was. They also talked about, there was a lot of concern, and I'm pretty sure in our survey of parents, we asked about doing temperature checks and whatnot, and they seem to indicate that with younger kids, fever is not necessarily even the first symptom. So again, to me, there was, again, there's kind of the CDC guidelines, and then there was kind of this discussion. So I wanted to just get your comment on, how you thought about that. And I would tend to agree at this point, maybe it's not even worth having that discussion, because we're maybe not even that close. So.
No, and the agreement amongst all pediatricians, and I will tell you, this is catastrophic. I mean, we have not had a generation of children that has ever repeatedly come through the office and said, I want to go back to school. This will be the first generation that will never complain about going back to school ever again. I mean, they desperately want to be back with their friends. And social distancing in the context of a first grade classroom for any teacher who's had first graders or kindergartners, I really don't know how that's going to work. We might have to put them in inner tubes, and that's the only way we can keep them that far apart from each other. But I think that these are very fair discussions to have. I think, unfortunately, where we are right now in terms of community spread, my biggest fear is how will we handle putting the kids back? And I sympathize with everybody. I sympathize with the single mom who has to go back to work and has to put that kid somewhere. I sympathize with the family that doesn't have a computer and doesn't have Wi-Fi access. I sympathize with the kids who fell off the radar at the end of this year, teachers who could not get anything back from them. But the fear we have is we put everybody back, and within about a week, we're going to have enough exposures and enough quarantining and enough discussion about how did this happen, that right now what is looking as, in my opinion, a very well thought out process that you guys are undertaking, there may be a lot of complaints about that. But I can definitely tell you that the questions you all are considering are relevant, they're important, and they will be very important once the consequences and the fallout comes from that if we just move forward and don't take them into consideration. The pediatricians will agree across the board. We want kids back. I would love to go back. It's just hard. This is an impossible choice.
Yeah, I would agree with that. So I wanted to ask Dr. Minter, I've actually gotten on the state health site and look at a lot of data. And again, some of this may be moot, but this is my chance to ask you some questions. So I guess I'd kind of like to do that. So and I know Charles asked you one of the questions that I had because there was a presentation that I saw and got a hold of, and it was talking about probable cases, and which would inflate the number of cases by an infinite amount, and or an extraordinary amount. Let's put it that way. And so I had asked whether those cases were being counted, and I got the answer back that no. And I see now that Texas Department of Health has a little disclaimer or a little note on the spreadsheets that they put out every day, and it says that they're not. I know looking at the data today, I saw that a few days ago, Bexar County had to remove about 3,000 probable cases from the database. So I want to make sure that we're strictly using confirmed cases in Fort Bend County.
So yes, we have only used the PCR positive tests. That's all we have ever used. We do absolutely collect the data from probable cases. There's a CDC definition, and that is part of what we need to do. But if you're talking about what is listed on our website, it is the RT-PCR laboratory confirmed cases.
Okay, so again, just that means that we're not including positive antibody tests as well in those.
No, not at this point. Those are in another category.
Right. I know at one point they were all commingled, and then they got split off in March sometime.
So correct, and they were commingled, but because of the difficulty in even getting data from the state, we got our lab reports that were RT-PCR, and that's what we counted from the hospitals, from the labs. And then when we would get data dumps from the state, we would still pull out the antibody testing. You have the ability to see what kind of test it is. And so we would still pull those out. Did that happen in real time all the time? Maybe, maybe not, but we always data scrubbed and got it out. So our numbers have included RT-PCR laboratory confirmed test.
Okay, good. I think that's good for everybody to know, because there's been a lot of discussion. Again, social media. I believe everything that you see out there, but it raises valid questions, and people have concerns that numbers are being inflated. I had the same concerns. That's why I asked that question. So, let's see. So, can you define or just tell us? I mean, you've kind of it kind of gets a little bit back to something that Kristen asked, and what Mr. Siebenaler and others have said is, what is the definition of code red for Fort Bend County?
Okay, so code red is uncontrolled spread, and that's because we see the numbers go up so quickly, and we don't have the ability to control that with contact tracing, isolation, quarantine. Okay, so that's really where we are right now. And I think there have been several questions about how did we get to red from orange? Well, orange was significant spread. We were starting to see the numbers go up, and it was definitely significant spread. At that time, we were starting to really stress on how did we quarantine. People in the community knew that they were having a hard time going back to work because we couldn't keep up with clearing people, releasing people, but also isolating people and making sure that they stayed at home. Now the rate is to where we can't. We've hired, we hire people, and we've gotten into new systems, and the numbers are just so great. So let's say that we could contact trace 50 a day really well, like do all of the cases and do all of their contacts based on everything we have, and do it completely from the moment we get them in, every one of their contacts. Let's say we had the ability to do 50 a day. Well, if we're getting 200 a day, that means every day we're 150 behind, right? And so those are people that we should know, but we try to tell them at the end of their, whenever they get tested, go ahead and isolate, but people don't necessarily do that. So that's more disease that continues to go out into the community. So if that answers your question a little bit, it's that we are in an uncontrolled state of significant community transmission. And until we get a handle on that, until we get less cases, then we're not going to be out of that situation where we're constantly chasing. And when we're constantly chasing, disease is going to spread. It's so highly contagious.
Okay, so basically then it's based on the increased number of cases. Is that what determines the code?
Yeah, that, and the fact that it has overwhelmed our ability to respond, right?
Okay, so does the fact that the hospital folks feel like they're overwhelmed, does that enter into that somehow? Is there some kind of a number or a certain capacity? Or
yes, it's the entire healthcare system, from public health all the way through to tertiary care. Absolutely. And
okay.
as we said before, it lags behind even the increased numbers. Then we'll see the increased hospitalizations, and sadly later we'll see the deaths.
Okay. So
would you all mind if I shared my screen quickly? I'm not going to share a PowerPoint presentation. Don't anyone worry about that. But I just want to show you what the case volumes look like throughout the 8-county region. Mr. Burdine, would it be okay for me just to share this real quick?
Sure. Thank you.
So I hope people can see this okay, but getting back to your point, Mr. Rosenthal, over the past 5 weeks, we've seen not a linear progression, but an exponential progression in terms of new cases. And this skews Fort Bend a bit because Harris County is so massive. But when you look at the number of new cases over the past 5 weeks, it's gone up just ridiculously so. And so we're at a point of we're perhaps, hopefully, not everyone knock on wood, but hopefully we're at a point where we're seeing a bit of a plateauing. Unfortunately, what we don't have a good feel for right now, and perhaps Dr. Minter can comment on this, is that plateau going to stay a plateau at this level for a period of time? Or are we going to see this go down over the next couple of weeks more precipitously? But what we're preparing for at the hospital side of this is that we're anticipating we're going to see the same level of case volumes for a period of time before they drop, which means the healthcare system is going to continue to be strained for the foreseeable future. Now, this isn't New York. So going back to Dr. Rezvanku's comment about what we learned from New York, we were lucky that we did not experience what happened happened in New York, which was much different. And if you look at the case fatality rates in New York versus in other states, so hopefully everyone can see this, we have been very, very fortunate that we've not seen the same CFRs that you've seen in other states. And so part of this was we learned, and states like New York and New Jersey had to make very, very uncomfortable decisions back in March and April. We've not had to make those same sorts of decisions, and our ability to deal with the current issues and to not have to put ourselves in those situations depends on the ability to keep things from spreading on a go-forward basis. So this next month is incredibly critical for all of us, and that's why we're taking just a more I guess really a transparent view on how this looks, because I think the public needs to understand that their personal accountability is huge at this point in time, and not only for the hospitals, but for each of us and for the other businesses in Fort Bend County. I'll stop sharing now. I'm sorry, I'm not trying to get up.
Thank you. I think that's very important, and actually that gets me back to I know where I wanted to go before, because you used the word case fatality rate rather than infection fatality rate, and so I think that obviously we know from our surveys there's a lot of fear here, and obviously what you guys are saying, a lot of it is perhaps justified, but I think people see these high case fatality rates and they forget that there's a lot of people that have gotten this disease. They've been completely asymptomatic, which is why I originally brought up the what do you call it test? Not the PCR, Dr. Minter, what were we just talking about?
Talking about the antibody test?
The antibody test. So you brought up, sir, kind of where I was heading with this. I know none of us have crystal balls, but you kind of stated it looks like, at least for right now, based on the data that we have tonight, seems like things may be plateauing. So I wanted to again bring back up the antibody tests. Do we have any data? I know there's been a lot of studies. When these things first started happening, I was tracking studies and plotting them on Facebook, because obviously the infection fatality rate is much, much lower than the case fatality rate. And since the county is actually handling these antibody tests, is there anything that you can say based on what you see, but what is maybe the actual infection rate, either for the county or the state? Do you have any predictions? What I'm trying to get at is to open up your crystal ball, because I know they're all very accurate, that we all have those accurate crystal balls for this thing, but to just maybe try to shed some light, so maybe even some hope that that things will turn around sooner than later. And I wanted to see if those antibody tests would shed any light on your thoughts there.
So I guess I can say first that we you can look at what disease mitigation, what number, and we look at percent test positivity. So for Fort Bend County, what we can actually calculate accurately is the test that we know we're doing and we receive. And that means the county operated sites. Okay, so we have 6 to 7 operated sites, and that's what we calculate. So our percent positivity back in March, April, earlier May was somewhere around 3 to 4%. Although that sounded really good, we weren't testing a lot of people. So it was a great number, but was it a true number? We really didn't know what was going on. Now we are actually testing a lot more people. So our percent positivity is a truer gauge of what's going on. Our current percent positivity in the region runs between 10 and 14%. So it's quite.
Antibody test we're talking, strictly antibody?
No, this is the PCR test.
Okay.
We don't do metrics on the antibody test, and I'll get to that in a moment. I just want to talk about the percent positivity and how we use that to gauge kind of the level of infection in our area. So again, it's not saying that 14% of our population is positive. What it's saying is 14% of the tests that are done are positive. Right. And so in the area, and everywhere, if you're doing the right amount of tests, what has been thought is that at about 6% or below, you have mitigation of disease. And so that would be our aim. Regardless of where you're plateauing, you don't have mitigation until you get below 6%. And then below 3%, you can talk about suppression. And that's, of course, where you want to be, before you start opening things up. And you will see that on many of the academic websites, I think Harvard's and Hopkins, that they'll talk about those are some of the aims that you'll get to. Now, as far as, and that's using your PCR, your RT-PCR tests. As far as the antibody testing, antibodies are still being studied. They're really a good test to tell you about prevalence of disease in the area.
Give you a range. They're not going to give you an accurate number, more or less.
Right. They can give you a range, but what do they tell you? Do they actually tell you, especially with coronavirus? Remember, it's new, so we're still learning what it's telling us. Do they actually tell you about who has been infected with COVID-19? We're learning. Maybe they're getting a little bit better, but some of them aren't as good. So coronavirus could be your common cold or something that's not COVID-19 that you have antibodies to, not necessarily to COVID-19. So that may not give you as good of a range. And how long does that antibody actually confer immunity? Will that protect you? So there's a lot of things that we're still even learning about that test and how valid and how accurate it is. And you know that all of the tests that are done now, even the RT-PCR, they're all emergency use authorized. They're not, they haven't gone through the long, rigorous process that FDA tests usually go through because we haven't had the disease around. And that doesn't mean that that's with any new virus. It's not just with COVID-19. So that gives you an indication with the RT-PCR, we're very, very high. Even if we're at 14% and plateauing, we still want to get much lower in our community to feel that we've mitigated the disease.
Can I add something to this as well? One thing I have to tell you guys that when you do a antibody test, some of the studies have suggested that these antibodies don't last but more than 3 months and they plateau or they go down. So knowing the fact that we think, or at least we hope that we are protected by getting a coronavirus or COVID-19, and then we get a antibody towards that we're protected. But if you look at studies that people have done, that the antibodies disappear, or at least they go down. And some people, I've seen it, some people do come back to the hospital that who have been infected and come back and have a positive test again. Not necessarily they had a negative test, but they're critically worse. The other thing we have to understand is that what we're talking about is kids, not adults. What we've seen in Sugar Land, perhaps, and what Chris was saying was, we do a lot of adult medicine. I'm not sure if your county or place is ready to handle kids in the hospital, because that's a big devastating factor to understand that we had to make, well, Dr. Kabir has to make tough decisions at that point. So.
Okay. Well, I have some other questions I'll just take offline and maybe email them to Charles and he can forward on.
Yeah, I'll just add in one more thing. So there is a high false, the antibody testing is not very reliable. It's not being used. And I think with all things being said and done, we're in the midst of a surge. And in my opinion, we should not be opening until these numbers come down. And then, just another thing to mention, whatever process we do develop for the school system, once November, December hits and influenza comes back with or RSV virus infections, you're going to have to probably send children home until their tests come back and they are in fact negative. So no matter what, you're going to have an online platform that is going to be prepared for the winter and maybe for early part of the fall until the numbers actually come down. It's just no way around it.
Right. I think we would agree, and which is why, we kind of all agreed with the district that we need to get started online and make sure it's robust and usable, and because there'll be a lot of kids that, like you say, may have to resort to it if they come down with some type of system may or may not be COVID, but while they wait for a test result or quarantine or something. So I think the online system has to be there, and it's a huge part of at least coming back in the fall. So I'll stop, and I appreciate all your comments.
Thank you, Mr. Rosenthal. Mrs. Helliger.
Thank you. Good evening, everyone. Thank you all for being on our meeting this evening, and you all have answered a lot of our questions that the community has been asking and wondering. So I appreciate you all's candor and your ability to relay that information to us. I do want to say before I get started, Dr. Singh, I think that your last statement around relevancy, I think people will take more consideration of this disease when it gets closer to them. And I think that's what we've been seeing. And so that we can make the proper precautionary, take the proper precautionary measures, and so that we can eradicate this. And I want to focus on, Kristen actually asked a lot of my questions that I had, but one of the things around when we do go back to school, I wanted to ask was really around the transmission itself. And I know we've all been told to wash our hands repeatedly, to do the 3 to 6 feet. I've been hearing things around restrooms and air control, how air circulates through our buildings is a way for this disease to be transmitted. Can you all talk to any of that? Because that's one of the questions that I actually have for Dr. Dupree after this.
I can talk a little bit about that because we have a lot of negative pressure rooms inside our hospital system. So I think this is where timing is of the essence. So if you open up your schools and you have everything set up such that there is adequate social distancing and the positivity rate in the community is exceedingly low, having them spaced out enough, in my opinion, and wearing masks at specific times would be enough. When we talk about ventilation, we're talking about, either using a HEPA filter or a air scrubber of some sort when we have an active patient who is on, let's say, a breathing machine, like a non-invasive breathing machine, like a BiPAP, where the viral particulate is actually aerosolizing and going into the air. And so we need to clean that air out so that it doesn't impact the healthcare workers' chances of getting infected. So, I mean, that is for patients who are infected, who have, they're getting aerosolizing procedures, then we need to put them in these negative pressure rooms. Now, if you open up a school when the prevalence of this virus is low and you social distance and you have masks and you have, let's say, plexiglass around or face shields that will prevent this spread via droplet, I think that in itself is very important. And I think, the community needs to do its part. Like if a child doesn't feel well or feel sick, I think they should be allowed to just miss school that day. And so, if everyone does their part, I would not worry about air circulation. Probably the most dangerous place for that to happen would, in my mind, having walked through Ann Sullivan, was the school bus. And getting the kids to school, that needs to be thought out a little bit more carefully.
Okay, thank you. That definitely gives a lot of information to some of the things that have been going around. I've been getting fielding a lot of questions around the restroom and the air circulation from both parents as well as business leaders and teachers and administrators. So thank you for answering that. And I think the only other question, and I believe you've already hit on it when you talked earlier, is that we have to figure out, I guess, the traffic control, how we're going to move our students from one classroom to another, or even if we're isolating them or keeping them stationary in particular areas, even if it's the bathroom, the clinic, the cafeteria, or whatever that might be. We still have a lot of work to do. I don't want to take a lot of the time, a lot more of you all's time with the questions, because our board members have asked a lot of questions. I think I have a lot of more follow-up now after hearing your discussion, this discussion to the administration. And so I'll wait to see the updated conversation that we're going to have next after this to ask some additional follow-up questions. Again, thank you all for being here this evening.
Thank you, Mrs. Helger. We appreciate your questions and comments. Mr. Rice, whenever you're ready, sir.
Thank you, Mr. Burdine, and Dr. Minter, Dr. Razvanku, Dr. Singh, Dr. Ali, and Mr. Siebenoller. I want to thank you for being here this evening, as my colleagues have thanked you. I'm sure that you've had a long, full day already, and we've been in this meeting 2 hours now. But it's, as trustees, we're called upon to make a lot of decisions that impact the health and safety and welfare of our students. And so oftentimes these decisions are on topics that we don't have a background in, and thus it does behoove us to get some good advice. And I feel that we have received good advice from you this evening. And the fact that you are all local and are from and part of this community, I know you have the best interests of our community at heart. And so I do want to thank you for that. We have to follow TEA guidelines to a pretty great extent, especially when it comes to getting funded the correct way. We have a large budget, but every dollar is accounted for. Last Monday night, we bucked up against the commissioner when we decided to go online for an extended period of time, because last week we were allowed 3 weeks of online instruction, and then we had to return. And the next day that was changed to 4 weeks, and now we have 4 weeks plus possibly an additional 4 weeks. And so we are going to take advantage of that. During the summer, we were allowed to have student athletes return to begin summer training and conditioning. And actually, we had a spike in the number of cases of student athletes who were exposed to COVID-19. And frankly, we had to shut it down. And so did every other school district in the surrounding area. They experienced the same thing. In my office, I've had 7 individuals who were either exposed to COVID-19. Fortunately, only 1 tested positive, and now they have recovered. But they all got it the same way you're talking about, Dr. Singh. Either they were around someone who tested positive, or they were at their in-laws' house or relatives' house over the July 4th holiday weekend, things such as this. And while we are in a what is considered an essential business, managing design and construction of schools, I can tell you that the number of contractors who have been exposed is spiking significantly. And that is having an impact on our ability to complete projects on time. Fortunately, myself, I'm able to work from home and the office, but factory workers cannot assemble air handling units and switchgear from home. And we are seeing a delay in the delivery of some of those things. So we are wearing masks in the office, and we are social distancing, and we are doing all of these things. And so it's my understanding, in summarizing this, Dr. Minter, I'll just summarize what I believe I've heard you and your colleagues say, and you can tell me if I heard it correctly. We're in the midst of the red zone. That means it's uncontrolled. We're bumping up against the capacity of our medical facilities. in Fort Bend County, which are extensive, and it's recommended to take it slow. And I think I heard you say that you were glad that we at least had 4 weeks to see how it goes. We've got probably a week or two before school starts, and then 4 weeks to evaluate, and then perhaps we'll see at that time if it's time to reopen and the best way to do that. But having you here tonight and sharing your opinion, I feel like we're getting unvarnished information, and that it helps us make informed decisions. So thank you very much. I don't have any other comments, Mr. Burdine.
Thank you, Mr. Rice. Mrs. Allison Drew, did you have a comment or a question?
Yeah, I just have a quick comment that I wanted to make. I mean, first of all, I want to definitely thank you, Dr. Minter, Dr. Ali, Dr. Singh, Mr. Sipanala, Dr. Resvanku. I think that I'm a little bit touched by this a little bit more in that, I'm a nurse and I work in the IT field, so I kind of deal with this on a daily basis, and I'm actually challenged with actually doing the analysis of the data that is being put out there. And so I'm touched by it on a daily basis. And I just have to say thank you for all that you do and for, coming on the show and really talking to some of the points that, as I go through this on a daily basis, touch me. As a native New Yorker, I've unfortunately lost quite a few friends through this, as we went through this sort of initial period of discovery and figuring out, how we could handle this and this particular pandemic and how we could contain it. One of the things that the questions that come to mind, or the things that I think as I do this on a daily basis always comes to mind for me, and I'm hoping that someone might be able to speak to, is that this is not linear, in that we may have students of Fort Bend ISD and staff of Fort Bend ISD, but their children may go to school in different districts, and we have no way of really managing that data and figuring out where their red hot spots are and how they're doing with things. And then as we talk about the disease, a lot of what we don't talk about in this disease that I see in the data is not just mortality, but morbidity and how we handle that. And so if somebody could just touch on those topics for me to kind of round this out, I'd definitely appreciate that. But thank you guys for all of your input today.
Thank you, Mrs. Drew. Dr. Minter, could you answer that question?
Sure. I didn't know if Dr. Ali might want to speak to some of the morbidity. So I can't look at the disease in just as a district. Certainly we can look at what the pockets as far as zip codes go, but we have to look at the entire county. And that's also why we look at it as a region. When Chris showed the slides about the Houston region, we have many parents that work in Harris County and they live here. When we are very, very ill, we have the great advantage of the Texas Medical Center, and many, many, many of our families work in the Texas Medical Center. So this disease affects us across county lines, certainly across school district lines. So we cannot isolate per school district. We have to look at the health of the entire community. When you ask a question, I think about the morbidity. One of the things that I wanted to kind of touch on, we talk about the children, and right now we'll find out the more children are together, we'll find out a little bit more how they're affected in our community. But the adults, we do know something about. And so we look at the numbers, and you've got lots and lots of teachers. And I know my experience, 18 years in Fort Bend ISD, I do know that we have a lot of pregnant teachers. Sometimes they're on campuses and it's pregnancy is kind of in the water. We need to look at our vulnerable populations. And we've talked about that from the very beginning. 80% of people will do fine with this disease, but another 15% will not do so well. And then another will not do well there. And so we really need to think about our teachers and our support staff and how they will handle this disease. We know we've got several vulnerable populations. We know we've actually been tracking recently the average age of teachers in Texas. We don't know about, we don't have your data, but we know about the average age of teachers, and we know about the disease that occurs in that average age. But we also know when you have teachers out and you need a long-term sub, usually they are older teachers, and they're going to be teachers that are affected. We also know that those teachers in about the 40-year-old average age may be taking care of parents. And so they're going to have certain effects that are going to magnify in the rest of the community, even if children aren't affected. And we have to think about that on a global scale. So we've been looking at all of those different things. As a school, a vital part of our community, not only what affects those students in the school, but what affects the greater community outside of the school. So I hope that speaks a little bit to your question of morbidity and what it means. So much goes on when there's a sick parent. I don't know in Fort Bend ISD about the percentage of grandparents raising children, but certainly if you have a very sick parent who's of grandparent age, that will have an effect on the children as well. So we just really need to get the disease in general under control in our community so that we can reach that goal of face-to-face education. It is absolutely what we want. It's what we all want. That's what we share. That's the goal. But getting there, we need to be very, very careful on how we get there.
Thank you.
Thank you, Dr. Mentor. Well, on behalf of the board, I would like to thank all of you that joined us this evening, and thank you for all of your time and your knowledge and your expertise and your point of view. I think that we can all take away a lot from this conversation and help us navigate going forward. So hopefully at some point some of you can come back, if not all of you can come back if we need you. Hope maybe next time it won't be a hour and a half long conversation, but I can't guarantee that. So all of us trustees care, and we are a large part of this community. We want to make sure that we're being responsible for our community and the cities that we encompass in this district. So with that being said, why don't we take a 6-minute break before we go into this presentation so we can all stretch or use the restroom or get something to drink. Let's start back right a minute or two after about 8:02, if you don't mind. So I will see everyone back around 8:02 p.m., please. Thank you. All right. Dr. Dupree, whenever you're ready, sir, let's go ahead and continue with the presentation.
Sorry about that. Let's put my earphones in. So Garrett, if you would, or Stephanie, if you'd bring up the presentation, please. We'll continue on. Let me first say that as we get going again, that I think some of this conversation is going to definitely inform and reshape a few of the things that you've heard, that you're about to hear in the presentation this evening. I think we are in a very good place. We're going to go over a number of details this evening that we know the board is very interested in, as well as the community. I have gotten word to all the staff members presenting along with me that they need to move expeditiously through their slides, as I will. So board, please be sure to pull us back or ask questions if we're moving too quickly, but we do have quite a few bits of information to get through, so I'll get started. The next topic that we do want to talk about relates to our teachers. One of the big areas of concern we've addressed this week is, since last week's announcement that teachers would be asked to teach from the classroom, we have modified that expectation. So at this point, the way we're sharing it is all teachers will be provided a healthy, safe, no contact work environment. And I want to go back to some of the things that were just discussed with our medical professionals. Teachers working alone in an environment in their classrooms should be safe if we enforce our health and safety protocols. And we understand that many have childcare issues and online learning support that's required for their own children, and we are going to set up systems to support our teachers. So we would like our teachers, the preference is that our teachers would work from the school building to provide the best quality experience for all of our students. But we are not going to mandate that or require that while the district is still kind of in a code red or red alert. We're going to, however, set up the guidelines as to when we believe it will be safe, and we're going to do that again in conjunction with our healthcare advisory. And so we will be publishing all that information, as I mentioned earlier, online to make it very clear when everyone's supposed to be back in their classroom, and then also when students might return to that classroom. I do think it's important, though, as we have this conversation, as we give that extra latitude, because I cannot reinforce enough that we care deeply about our teachers. We are working to support them in such a way that they can help our students be most successful. And it's a fine line we're walking, because our teachers are at the bottom line. They are at the front lines of serving our students. So we need them to bring their very best to our students every day. So although some will choose, we know many will choose to work from home, we are going to have high standards of accountability and expectations. We also need to be very realistic that what's going to happen this fall will in no way resemble what we did in the spring. We're going to be taking grades. We're going to be assessing students. We're going to be delivering synchronous learning. That means face-to-face, real-time learning every single day. And so teachers are, in effect, working professionals like all other working professionals in our community. And they will be expected to maintain a schedule, whether they're working from the building or at home, a schedule that includes their planning time, their team PLC planning time, as well as their instructional time with their students. And so we know that they will still face challenges with their perhaps educating their own children, just as other working professionals will. So again, we are going to do our best to support them through extended learning and other opportunities that we're going to talk about in a few minutes in partnerships with childcare. But the bottom line is all of our team in Fort Bend ISD, every member of our team, will be expected to come ready to work and to serve our community and our students at the highest level possible when school begins. And as I mentioned, when conditions improve, all teachers will be expected to return to the workplace on a full-time basis. And of course, as long as the pandemic is around, even at low levels, we will always have systems over exceptions to be made with documented health risks. We will not ever do anything that would intentionally put a teacher at risk in any way. So just know that we do care, and we are working our best to produce an educational program for our students, and we want to do it in collaboration with our teachers, not in any way trying to strong arm or force them into a workplace that they're not ready to come to. But we will have high expectations for instructional delivery. I think it's important, because the conversations have been about, and I mentioned about the buildings would essentially be empty except for teachers in their room. We are not going to be gathering people in buildings. All of our staff, as I mentioned last week, all of our staff meetings, back to school meetings, they're going to be online. They're going to be held remotely and virtually so that folks can engage even if they're in the building or whether they're at home. In regard to instructional management, again, this is related. We've been working really hard for weeks and weeks and weeks to design the instructional program for this fall. It's got several components. It's got the back to school professional learning for the teachers so that they can be prepared to use all the curriculum resources, tools, and systems, the what that we describe and prescribe as a district. And then they're going to be able to take all of that and implement the how. They're at the school level. Teachers will be working directly with their principals on detailed schedules, the strategies, how they're going to engage their students, build those relationships, assess, and help students be responsible for their learning. So that's going to be the how, just like it is on any given day. The only difference is kids might be at the other end of a computer, not in the classroom with our teachers. But we're at a place right now where there's been lots and just hundreds and hundreds of hours, thousands of hours dedicated to this design from folks in the district level. Their work is going to continue. We're now going to turn our efforts at the district level, the top level administration, central admin, we're going to focus our energies now on building the systems that indicate when we return to school, what staging will look like, what face-to-face will look like during the coming months when that resumes. That's going to be our next step so that we can publish all of that well before we begin to execute any of that information. Now, campus, with today, officially, we passed the baton, if you will, to principals. And they're going to begin working under the Department of School Leadership oversight to now take us forward and really engage their teachers. So I need parents to understand they're going to be getting much more direct communication from the campus level, from the principals, from the teachers, the school administration, everyone at the school. And as parents have specific questions about their child's schedules and the school, what's going to be happening at school, they'll need to engage with the campus administration. So this Wednesday, we're going to do another big live event where I'll go over everything we're talking about tonight. But the parents need to appreciate that it's now time for them to work directly with the school as we get toward as the first day of school approaches. I also want to point out that I mentioned earlier that this fall will not look like the spring. I was talking to a board member earlier today, and she said something that really resonated with me. That she said that we're not looking for an exercise in compliance. We are not looking toward simply you do the amount of time, you do the work, you turn it in, you get your grade. We are truly reimagining education in Fort Bend ISD. So we're about delivering high quality, robust learning, mastery of learning in a new and different way. And I'm going to tell you, I don't think any of us really have a conception of what school will look like this fall when we start online. We know what we can visualize today. We know what we hope it's going to look like. But any vision that you might have of last August and what the school looked like last year, what classes look like, what scheduling look like, we need to wipe all of that clean away. Whether you're a principal, teacher, board member, administrator, parent, or student, this fall is going to look very, very different. And so just know we're all on the same team, pulling together with great systems that have been designed by a high quality team. As I like to consistently say, we are leading this area and we're leading the state. People are following what we are doing. And I'm proud of that because we've got a board leading the way and we have a remarkable staff that is on top of all of this building these systems. So with that in mind, I'm going to toss the presentation to Melissa Hubbard, our Executive Director of Teaching and Learning, and she's going to go over some key elements of our instructional expectations. Melissa?
Thank you, Dr. Dupree. And what I'd like to emphasize as we really think about the fall of 2020 and delivering quality instruction to students, we are going to build those quality learning experiences based on this framework and what we know to be good instruction for students in Fort Bend ISD. And so you'll notice here that we're going to focus really on building that academically rigorous content that's aligned to our curriculum and our standards, while building in those social and emotional supports to make connections amongst kids and teachers in an online environment. We want to continue supporting the profile of a graduate, specifically with communication and collaboration inside of that online environment, while also making sure that we're holding true to those student ownership of learning practices that we've been working on for the last few years, related to that progress monitoring and continuous formative assessment, giving students feedback in an ongoing manner, either peer-to-peer feedback or feedback from the teachers, and then working with kids to set goals and revise their work based on that feedback. So as we move into this and use this as our framework for learning, whether we're face-to-face or online, what we have to consider is, in an online environment, the how looks a little different because the kids are in the virtual environment and they're using those digital tools in order to interact. But these are our tenets that support student ownership that we're moving forward with in the online learning environment. So as Dr. Dupree has said in some of our live events, and also in the boardroom, we are working to improve that online experience. And so we are going to have scheduled live synchronous instruction for students, daily asynchronous learning to support that synchronous learning experience. And as was spoken before, this will be scheduled. So parents and students will be able to anticipate when those experiences are going to be. We're also working to streamline some of the technology tools so that there's consistency across campuses and grade levels and teams of teachers. We've also gotten lots of feedback related to the use of Schoology. And so part of what we are working on is developing those systems for improved navigation and course structure that we'll be providing teachers through training. And Ms. Williams is going to get to that in a little bit. We're also going to be working on some standard communication systems for parents within that. And there's a few features that we did not take advantage of in term 4 that we will be highlighting in the fall that help with that communication to parents, the calendar and the Schoology gradebook to help with progress monitoring. Again, we're going to continue to lean on formative assessment strategies. And those can be in the form of digital tools, student work submissions, and also that live interaction with their teachers so that we can really see what the students know and are able to do. And we'll be using ongoing feedback within the learning management system using those tools in order to give that feedback. We're also going to be adhering to our pre-COVID-19 grading practices, which align with our current policies and procedures. So again, we're going to focus on that remote synchronous instruction, that two-way real-time communication. It builds those relationships between kids. It also builds the relationship between the teacher and the student and provides an opportunity for teachers to provide explicit teaching and modeling and learning those new concepts. We're also going to be using that synchronous instruction to promote collaborative activities between students using breakout features and channels within teams. And we'll be using that synchronous instruction to confer with students and gather information related to their learning. That remote asynchronous instruction is really going to focus on student practice and creation of content and opportunities for them to use collaborative tools like Microsoft 365 and those apps within there to collaborate with their peers. The next slide basically is a broad overview about what a typical school week might look like for a student in Fort Benning ISD. We're going to get into greater detail about a daily schedule, but what I'd like for you to notice here is that we've taken some recommendations from the TEA related to synchronous instruction. And what you'll notice is that as the students get older, the amount of synchronous instruction is increasing. And so that's to help with some of the developmental pieces for a student, as well as some recommendations. We're also, you'll notice that for secondary education, there's a specific time allotment for mental health breaks and transitions. I do want you to know that those are considered inside of the elementary school day as well. Just those are typically built in with that interaction with the teacher. And so we don't have it indicated specifically like we do for secondary. But you'll see some greater detail about the school day in just a moment. So I do want to speak to the equity and access issue to make sure that as we start online instruction, that we have a technology distribution plan in place to make sure students have access to technology. So there will be a back to school readiness form that will be used to determine the student need and be able to assign the devices. Unlike term 4, where it was a district-led distribution, when we begin in the fall of 2020, we will have a campus-based model offering student pickup at their assigned campus for distribution of devices. There will be 2 phases, one that begins August 5th and the second phase beginning on August the 17th. That kind of wraps up our instructional expectations and the supports for students in gaining access to a device. And now I'm going to turn it over to Deanna, and she's going to talk about learning centers.
Thank you, Melissa, for providing that level of detail associated with the instructional expectations. As Dr. Dupree opened our presentation this evening, he listed a number of questions that we considered as we were continuing to develop our plans going forward with our online platform. So one of the questions that he mentioned was, what learning supports and childcare options will Fort Benning ISD consider? And so I want to share with you a couple of options that we've looked at, schools as learning centers and private childcare centers. And as we considered childcare and adult supervision option for our students, we really kept in mind equity, access, health, safety, as we were planning going forward. So as you'll see on the screen, when we think about reimagining how we might utilize our schools during this online platform to provide the safety and security for our teachers, along with healthcare options for families and our own staff, using schools as learning centers was a consideration that we've put in our plan. So what does that mean? A learning center would mean that a student could access learning and supports with adult supervision in a school building. Perhaps they would be scheduled a particular space. They would have access to technology. There may be adult supervisions, frequent breaks, and so forth and so on, so that if they did not have connectivity or things of that nature, there would be a place for them to access that via a school center. Obviously, as we consider how many students and which students we could serve, we would look at serving students with unique needs, prioritizing the staff, first responders, essential medical workers, and active U.S. military. Again, I mentioned when students, we would also consider students who are in need of internet connectivity and access to technology. And obviously, this would be a place for staff, parents, and parents to access childcare via supervision during the instructional day. In terms of utilizing our staff, we may hire and or redirect non-instructional staff to assist with monitoring and supervising students as they interacted in the online platform at a workstation. We would look at, based on need, where would we strategically locate our buildings within each feeder pattern, in terms of designating a building as a school center. Again, we're going to use eligibility criteria, and as I move into the next slide, I'll talk to you a little bit more about what that looks like. Before you go there, can you go back one? I'm sorry. I did want to share, Dr. Dupree mentioned that we would be partnering with private childcare centers. That's incredibly important for us to unite with our childcare centers and look at how we can partner with them. So in addition to possibly opening schools as school centers, we can also partner with our childcare centers to provide the childcare that our staff and or our parents may need. Thank you. And so as we make determinations about how we might determine who would access a school center, I want to share with you an enrollment verification process. Now, our enrollment verification process is something that we engage in annually. And it's important that all parents and families complete the enrollment verification process. I want to make very clear that this enrollment verification process is not the pre-registration process that we previously talked about in a number of communications that we've shared with families. As Dr. Dupree said, the pre-registration that we referenced prior to, when we get closer to determining possibly opening for face-to-face, we will initiate that process. But this enrollment verification process is something that we launch annually. What we're adding to the enrollment verification process this year is what we're calling a back-to-school readiness form. And this readiness form, as I said, as part of the enrollment verification process, is going to be critical for parents to complete so that we can determine technology needs, possible needs for extended learning, transportation, and any child nutrition needs. One thing that I failed to mention on the previous slide, and I want to make clear as well in terms of the child care option, with opening school centers, we would also continue to offer before and after school child care via extended learning. I'm going to kick it over to Stephanie Houston, who's going to talk a little bit about monitoring protocols.
Thank you, Deanna. As we transition to online learning, the online learning environment, we knew that monitoring and accountability would be critical. So as Melissa mentioned, all of the new learning that teachers are going to engage in, we want to make sure that we have a plan in place to monitor online learning with fidelity. So as we began working to determine how principals would monitor instruction, we started this thinking in the spring. And we came up with what we would use as a monitoring protocol. That monitoring protocol is to just ensure that we have alignment across our campuses as principals are monitoring instruction. This alignment monitoring protocol is also used for elementary campuses as well as secondary campuses. As you see the framework on your slide, we use this framework in the spring, and we wanted to make sure that principals would have clear communication on defining the expectations of what the online learning would look like. And I just wanted to share this model I used as a principal when I was at Ridgemont, and the model really helped to support principals and helped me to as on my journey to really taking care of how I needed to make sure we had shared expectations with our teachers. So with that in mind, we will have inspections of the expectations. All of the expectations that Melissa mentioned, we want principals to engage in inspecting those expectations. And during this part, Department of School Leadership, we will help assist principals with developing professional development if they see trends and patterns based on the data that's collected through their inspection of the expectations. And then we want to make sure that our principals are equipped with having feedback conversations with our teachers. As students, they want feedback on how they're doing with their goals, how they are progressing towards their learning and the expectations that's set for them at their grade level. Well, we want to make sure that our principals are engaging with our teachers, providing feedback on their practices as they do virtual walkthroughs using an online tool that would help principals gather data and be able to have productive conversations, timely conversations, as well as specific information to share with teachers how to improve their practice. So now at this time, I'm going to turn it over to Ida Ford that will talk more about scheduling.
Okay, thank you, Stephanie. So in this slide, I'm going to review the elementary model schedules. And in the slide that you see here, this is a sample of a kindergarten student schedule. This schedule allows for 2 hours and 45 minutes of synchronous instruction, which includes the 45 minutes for the intervention and enrichment that allows for the more focused approach to addressing students' needs. The schedule also includes 3 hours and 15 minutes of asynchronous instruction daily. And of course, you know, the asynchronous time, as Melissa stated before, is a combination of student practice, creation of content, opportunities to demonstrate understanding, self-assessment, and also allows for that mental health and transitional breaks. We also have in this schedule a designated lunch and recess time that is for all grade levels. It is the same time of day to maintain the consistency and assist families with their daily planning. Okay, in the next slide, you will see this is just an example of a 3rd grade student schedule with ELA in the morning. The only difference is the snapshot here just gives you an idea of what it looks like on a Monday, Wednesday, Friday, and a Tuesday, Thursday. They have 3 hours and 25 minutes of synchronous instruction daily, which is also including the 45 minutes of intervention and enrichment. And then they have between 2.5 to 3 hours of asynchronous instruction. Same thing with the lunch and recess, consistent across grade levels, okay? This slide shows you the breakdown for the teachers' schedules. And in the teachers' schedule daily for pre-K through 1st, they will deliver 2 hours of synchronous instruction, and 45 minutes of that synchronous instruction is dedicated to that intervention and enrichment that I just spoke about. For monitoring and feedback of instruction, they have 2 hours and 45 minutes. So the monitoring of feedback, monitoring and progress monitoring and feedback is designated time basically to progress monitor students through the interactive digital tools, review student work submissions, live interaction with teachers, just to monitor students' progress. And it's consistent and ongoing feedback. The 75 minutes for professional learning, of course, includes unit and concept and lesson planning, student work analysis, design of course materials, and learning during that PLC time. And every teacher receives 75 minutes of PLC weekly. Also, you see that there is a 45 minutes of teacher conferencing, of course, to meet the needs of parents and schedule parent conferences. And also that time can be used to continue the planning for instruction. Those times are consistent with 2nd through 5th grade. Every teacher still receives the 75 minutes of professional learning, the same conference time. The delivery of synchronous instruction, of course, changes because as the students get older, there's an increase in synchronous instruction, but they also receive the same monitoring and feedback opportunities of asynchronous instruction. Okay. And now for Jenny Nichols for secondary.
Hi there. In designing the secondary online schedule, we are keeping the middle school and high school schedules consistent with one another to accommodate teachers who may be teaching at 2 different campuses or middle school students who are taking high school courses at the high school. So as you can see in this schedule, students will engage in 4 hours of synchronous learning each day, and they will begin class at 9 a.m. On Mondays, Tuesdays, Thursdays, and Fridays, students will take 4 classes with 1 hour each, with a break or transition in between each class. On Wednesdays, students will see all of their classes for 35 minutes each to allow the teachers and students to have a midweek check-in with all of their classes. We've also embedded time for students to work on asynchronous learning, although asynchronous lessons and homework can be completed at flexible times for the student. Okay. For the secondary teachers, we have allocated time for meetings, plannings, professional development to fulfill those instructional expectations for online instruction. So we've allocated time in the morning as well as in the afternoon with dedicated PLC or conference times. Teachers will continue to have a conference period during the scheduled periods. And just like with the student schedule, breaks and transitions are embedded into the schedule, allowing teachers to transition to the next class or prep. Okay, and in general, secondary teachers, their schedule will look like 4 hours of synchronous instruction daily. There's 90 minutes of dedicated PLC time 4 times per week. We have embedded monitoring and feedback on asynchronous instruction time about 2 to 4 hours weekly, and as well as that dedicated conference time, 480 minutes over a course of 2 weeks. And at this time, I'll turn it over to Dr. Pilar Westbrook.
Thank you. So we know that the mental health and well-being of our students, staff, and parents is paramount to ensuring that the foundational needs of safety and security are met. If we can meet the needs of our students, staff, and families, then teachers will be ready to teach, families will be ready to turn their students into the schools for learning, and students will be able and ready to learn. And we know that we need to foster relationship building across campuses and classrooms. We need to create compassionate, trauma-informed cultures. We're going to do this through training. We want to enhance the supports that teachers and administrators have in their toolkit. We want to provide for safety and understanding to build our compassionate, social distancing citizens in preparation for school around health and safety. We're going to help with building relationships and norm setting so all students get to know each other, teachers get to know their students, students get to know their teacher, and all work together, create a supportive learning environment. As well, we'll have training to support a trauma-informed culture to address the unique needs associated with COVID-19. We'll provide signs and symptoms to look for to identify students in need, and we want to make sure that our staff can walk away with practical strategies to set up these compassionate, trauma-informed classrooms. In the next slide, we're talking about the fact that we have our school counselors, our social workers, and our mental health counselors available to students, staff, and families, ongoing, but also those who need additional support. And I'll go ahead and turn it over to Stephanie Williams.
Thank you, Pilar. I'll talk just a few minutes about the professional learning models to support implementation of the expectations that the team has outlined today. There are 3 components of professional learning, beginning with required professional learning that reinforces our instructional priorities and models an online environment. The Campus Professional Learning Week is designed to prepare teachers for the launch of online learning, while the job embedded component supports teachers throughout the year with identified needs in time to deliver instruction. This slide outlines the required professional learning. The content of the required professional learning focuses on the role of formative assessment in developing students as owners of their learning. It models these practices in a virtual environment. It also models other online learning best practices for communicating and engaging students in collaboration, while providing input around the types of activities that teachers might engage in to build social emotional skills in students, as Pilar just outlined. Finally, this course endeavors to build basic technology skills around the use of Schoology. This is an evidence of practice model as outlined in the academic program audit, where we were challenged to shift professional learning from a sit and get to a long-term professional learning that requires evidence of practices with students. There will be job embedded supports throughout the year, and these courses are differentiated. Teachers were invited to choose among 3 courses related to their level of implementation of these practices. When we look at the campus professional development, we are changing our model for launching professional learning, launching the year with teachers, which will begin on August 6th. Every day, teachers will engage in 2 to 3 hours of learning related to the expectations that have been shared here today. The other 4 hours of a teacher's day will be focused on practicing, doing, and creating online course content through technical skill development and demonstration, and of course, time with their peers to collaborate and develop learning experiences. The course content for the setting expectations will begin with a focus on delivery of a balanced, unbiased curriculum as aligned with policy EH local. From there, teachers will begin to build skills and content to build a classroom culture virtually with their students. In addition, we will cover health and safety protocols and wellness first, beginning with our teachers and self-care, and then how they can recognize some of the signs and needs in our students. Our instructional expectations will center around the strong curriculum development that is underway, aligned to the learning framework that Melissa shared earlier. In professional learning communities, teachers will have time to design units, concepts, and lessons within Schoology. Earlier, Melissa mentioned streamlined technology tools, and this technology skill development course will focus on a singular video conferencing tool in Microsoft Teams. It'll build skills around the Schoology learning management system and how to set up courses and use the functions like calendar and gradebook. And then it'll model other tools such as a Respondus lockdown browser, which will be used to ensure the integrity of assessments, and ClassLink, which will be used for a single sign-on to make accessing instructional resources easier. Within the professional learning community, we want time for our teachers to collaborate and build the learning experiences that support the rigorous shift, which we will launch in the fall of 2020. After we finish our professional learning, there are some other considerations, operational systems for support that must be in place to ensure students and teachers and staff can engage in the learning environment. And one that's been mentioned here tonight is related to air filtration. So one of the things that we want to share is that Fort Bend ISD, we are increasing the filtration capacity from what is known as a MERV 8 to a MERV 13. Now, if those terms are a little bit unusual to you, they were to me, but what's important to know is that the American Society for Heating and Air Conditioning Engineers recommends this shift to a MERV 13 for non-hospital, non-medical locations. So this shift improves the capacity, in simple terms, to capture air particles from about a 70% capacity with MERV 8 to a 90 to 98% capacity at capturing particles with a MERV 13. What we also know is that our current systems can handle this and continue both the efficiency and reliability in filtration. When we think about child nutrition, it is our goal to continue the grab and go meal service, just like we have been doing so far throughout the year. We will have 2 serving times that'll be offered to accommodate breakfast and lunch for students with various pickup locations. And it is important to note that we are awaiting guidance for the funding related to this, the free meal waiver for 2020-21. All students on free meals would continue to receive this free. The waiver would allow us to continue to provide this service for our reduced and full price meal students. Related to transportation, as we continue to look at bringing some students into the building, we recognize that transportation will be needed, and we are looking at initial providing that transportation to those students who are coming into the building through the Learning Center or students who are served through special education services. Obviously, there will be some limits with transportation based on the social distancing requirements and the seating structure that we're able to establish, and the team is working through developing those now. On the agenda tonight for approval is a revised proposed 2021 school calendar. Just a few of the details of this calendar. This would require teachers engaging in campus professional learning beginning on August 6th. August 17th would be the first day for students. This shift would allow us to front load 6 days of teacher professional learning. As the district rolls out more of the expectations related to launching online learning, a dedicated need has arisen to ensure teachers have the time to prepare, and this calendar allows for that. This calendar does meet all TEA guidelines related to minutes and banked days. It does reduce the total number of instructional days from 175 to 174. And it is important to note that the changes in this calendar all impact the first semester. And that if we were, and those changes include September 25th, the County Fair Day, being removed as a holiday. Now, we recognize and want students, if that county fair does continue, to be able to participate in the county fair. So we're reserving the option to have this as an asynchronous learning day and still allow student participation. Previously, Friday, October 9th was a professional learning day, and in this calendar, it will transition to a regular school day for students and staff. Looking at the schedules that both Jenny and Ida shared earlier, there is consistent time for teachers to engage in professional learning and professional learning communities, so we hope that will be adequate to make this change. You might also notice that the required professional learning, or what some call the floating professional learning days, have moved to November 23rd and 24th. And those days have moved there. That allows us to bank some of that time. It also is important to note that teachers who have completed their professional learning will take those as part of the Thanksgiving holiday, while teachers who have not completed that required professional learning will have dedicated time to complete it before the due date of December 4th. Again, this calendar is a proposed calendar for review by the Board of Trustees tonight. I'll turn it over to Dr. Dupree now to finish the presentation.
All right, as you can tell, there's been a lot going on. We're working fast. A lot of people are working hard. I think we've given a good overview on the major issues. Going forward, we're going to do another live event this Wednesday to update our community. Also updating the website tonight, sending a staff message so that they can know exactly what's going on. This full presentation and conversation with the health professionals will also be posted on the website on the board's meeting recording. So we're going to continue on an ongoing basis to refine all of these steps with our, as I mentioned earlier, our goal is to open school online. Simultaneous with that, we will be developing the protocols and the milestones, if you will, triggers for what it will look like to open schools for face-to-face. And then we're going to be working on the campus bell schedules, communicating all those details to staff and to parents about what the academic programming will look like. As we mentioned, we are going to begin releasing the online parent, not enrollment, but the student verification that we need. We're going to need all parents to begin that work right away when that opens up later this week. Now, during the coming few weeks, we will need board action on a few items. First of all, tonight, we're asking the board to consider action to modify the calendar. TEA is going to require us to submit a synchronous learning attestation. And that means that we are attesting that we are doing synchronous learning. That's the way that they're verifying and allowing us to get funding. We also have to do an asynchronous learning plan that actually has to be approved by TEA. And the board needs to approve both of those or take action to authorize me to submit them in advance. At this point, we're still determining exactly when those are going to be available. It's possible we'll seek board approval at the August workshop meeting, or if necessary, I'll work with Mr. Burdine to do a special called meeting for the purpose of submitting those in a timely manner. We're working out the details there as TEA guidance is still evolving as well. We're also going to have to submit an online learning environment extension waiver to TEA. And then at some point in the near future, we're also going to have to talk to the board about how to handle the needs of any staff that may be idled while we are doing online learning. For example, in the spring, we had bus drivers and various folks that were not working full-time because we weren't running buses. Now, I will tell you, for the fall, we are not rushing toward that resolution. Our goal is to determine how to find alternate opportunities to keep everybody working, doing something that's functional, that is needed for the district, whether it's working in the learning centers, whether it is helping with as wellness monitors on campus. There's lots of jobs that we have not had before that we're going to have. And I believe we believe we've got a lot of qualified people that may be retirees who had professional careers and now they're driving buses for the benefits. And we definitely want to continue to keep them working for us. So we may come back with some form of a resolution, but for now we're working out those details, trying to put everybody in a job that would enable them to continue to earn their pay rather than simply paying staff who don't have a function at this point. So with that in mind, I'm going to turn it back over to you, Mr. Burdine. That completes our presentation, and we're happy to respond to any questions the board might have.
First, I'd like to thank you, Dr. Dupree, and your staff on all the hard work and all the details in this presentation. There's a lot of information there. I know we have just a few questions, so I'm going to go ahead and start off with Mrs. Kristen Tolsan whenever she's ready.
Thanks, Jason. I appreciate it. And thanks, guys, for the details included in this presentation tonight. I know we as board members have received a lot of questions wanting details from parents and teachers. So we appreciate you guys presenting this tonight. I have a couple of follow-ups. Back to our special education students. You stated earlier in the presentation that these were going to be ARD-based decisions. So my question is, do we have a timeline for completing ARDs, when ARDs will be completed, and when we can let parents know whether they will have that choice?
Dr. Hill, can you respond to that, please?
Yes, we are planning to start contacting parents next week and talking about the proposals and whether we want to have an amendment or an ARD meeting. We anticipate those ARDs will all be virtually, and they'll start next week as well. We also plan to send some detailed communication out to all parents that are served with special ed and 504 services this week. Some written communication that'll come through email, and then also doing some video communication so that we can provide additional information to them.
Okay, thank you for that. I know there are a lot of parents waiting to hear what's going to happen. I know it takes ARD meetings sometimes a long time to get through. So I'm glad we're going to be starting that, getting the communications out and starting that next week, because I know it's going to take us some time. My other question is about the triggers that you mentioned, Dr. Dupree. You said you guys were still developing those triggers for when we would be opening or closing schools, and that those would be posted online. Do we have a time frame for when we think we can get those made public?
So at this point, I was actually making quite a few notes during the meeting. I think we have 3 streams of work, if you will, taking place right now. The primary and the high priority stream is to get schools open on the first day of school. But as I mentioned, we are passing the baton to the principals and Department of School leadership on a lot of that work. Of course, there will be things like technology distribution and some of those things that staff are still going to be working on organizationally, but we're going to really rely on the campuses to take the role forward to begin opening school with our support. Meanwhile, the staff at the district level will begin working on those plans and kind of, again, the transparent plans of what the triggers would look like, what any back to school opening would look like. My goal and hope would be that we could publish all of that by or around the first day of school, so that as we start and as we begin the online journey, people can know when we're going to start reconsidering decisions, when we're going to look at data, and how that's all going to flow, because I want to be very transparent about that. So I think we need to take the right amount of time that allows us a chance to come back to the board to share that in August at an August board meeting before we would go public with it. So I would say about a month out, we would have that prepared to share with the board.
Okay, so I know some of the doctors this evening during the panel discussion listed a few of those, and so that kind of jump starts us and gets us started. I do think the sooner we can get that out, the better, because parents are trying to make decisions about what to do with their kids and how long we expect online to continue. I know we're saying 4 weeks right now, and it's our goal to get, to get us at least phasing in as soon as possible. So I'm glad to hear that we're going to get started working on that as you guys phase other things over to the principals. One comment about, the idle staff resolution. I am glad that we're looking to keep our employees working. I'm sure they may be doing things they didn't foresee when they first took those jobs, but I do think we should use our staff, our personnel, as much as we possibly can. I think I'm sure you guys know that things are going to come up that we didn't think of. And there may be ways for them to really support our campus staff, or maybe support students. And I really support that, keeping them working for us. The other thing I want to make sure that we do, and I know you guys are already doing this and thinking about it, but it's the teachers and the principals and the campus staff and the parents this year who are going to have to implement these plans. Plans are great. I know right now it's how we expect it to go or want it to go, and we all know it's going to look a little bit different than we thought it was going to look. So I just want to make sure that we're listening and that we're listening to what they need, and that we're responsive and supportive, not just of our teachers and our principals and campus staff, but of our parents who are going to be, especially with their young kids, having to implement all of this every single day. So I just wanted to put that out there, because as a parent, I'm thinking about what this is going to mean for my student who's going to be at home. The last thing I want to say, I'm going to go back to our conversation with the medical professionals. And I know other trustees probably feel the same way I do. I have grappled with this decision. We've received emails from community members and parents and teachers on both sides, many wanting schools to open back up. I'm completely sensitive to and sympathetic to families who have students with special needs who need support, families who are facing financial burdens if they can't get back to work. Very sensitive to the impact this will have on the economy. These are the kind of things that I didn't envision having to really think about as a trustee, and now we are facing it and having to think about it. And I don't think, I'm not sure all of our community and even our employees can possibly understand the burden that this is for a lot of us as elected officials. And I know you, Dr. Dupree, and your staff trying to make these decisions. And the best we can do is weigh all the information and the data that we have and make the best decision we possibly can for our students and for our staff, and then ultimately for our community. And I just wanted to say that, after doing a lot of research myself and then listening to our team of advisors and having to really focus in on what's happening in our community, not in every other community in the United States, but in our community, that I have to continue to support starting school this year with online learning. I can't envision a way for us to go back to school right now with what our healthcare community is facing. And as much as I worry about, the students who aren't going to have the support at home, or the families who are going to struggle, I have to go harken back to our goals and objectives in Fort Bend ISD and what our job is. And absolutely, it's equity and access to the curriculum. And I think all of us are going to make sure that we're accountable for providing that. But we have to take into consideration the safety of our students and our teachers who are our workforce. And taking all of that into consideration, I have to continue to support that while working to phase us back in as soon as we possibly can. So I just wanted to put that out there and let everybody know what I was thinking, and I'll pass the baton. Thank you, guys.
Thank you, Mrs. Tossan. Mrs. Helliger.
Thank you. Thank you again for the information. I think everyone's been on pins and needles waiting for the information that was presented tonight to see how we would deliver instruction for this upcoming year. So definitely looking forward to see how this continues to evolve and how we help our parents and teachers prepare for beginning of school. So I kind of wanted to ask the question of, you know, as I'm listening to the doctors and their conversations, so as we start to phase back, phase students in, and for those that possibly will be there, is what are we partnering with any other groups or organizations to spread out school? For example, hold on, someone told me to change the light. I can't see, sorry. Thanks. Have we thought about partnering with any other like organization, like churches or anything like that, to have school and spread out more in different locations?
So there's
That's the
two,
first one.
yes, Ms. Helliger, there's two different ways we're partnering with others. One is through the private childcare, and that would include any faith-based childcare or private schools, because we want to be able to, anywhere a child is going to be who could potentially be a Fort Bend ISD student or the child of one of our staff members, if they're more comfortable putting them in their private childcare than while we're closed or they have to work and they're getting their care, we want those folks who lead those organizations and their staff to be trained in how they can help the parents continue online learning while they're in their care. So that's the first phase that we're doing. The second phase is going to come when we return to online learning, and this is something the Commissioner of Education has asked me repeatedly. He says, are you going to use churches or other large spaces that might be available in your, if you need more classroom space? So for example, if we need more space because we're reducing class sizes to be very small, are we going to need more rooms that we just don't have? And the answer is yes. At some point, when we get there and determine the need, then we'll be reaching out to the larger entities in our organization that have basically unused Sunday school rooms 5 days a week, and offer to partner in those kinds of spaces throughout our community, if and when we get to that point.
Good. I'm glad to hear that. I'm glad we're thinking outside the box with that.
Mm-hmm.
I also wanted to, someone asked me to ask this question. If a class shuts down, what happens to the pacing calendar for curriculum and grade levels, especially those that are at testing grades? Have we thought through that yet? I know we're still planning and still developing.
We are, yes, ma'am. But I'll tell you, I'll give an answer, and Deanna may want to jump in, but all the work we're doing that you even heard some of the update tonight, I have said consistently to staff is our teachers need to organize their instruction and have systems in place so that if they and the kids walk out of that room on any given day and they cannot come back tomorrow because of an outbreak, learning continues. So there's always a little flexibility in the pacing calendar that allows for reteaching and relearning and those kinds of things. But in my view, the goal is that we're using these tools, we're practicing these tools so that we don't have long-term outages in the system if there's an outbreak in a classroom or even one diagnosed case in a classroom or in a school building and we have to close. Deanna, would you have anything to add to that?
Well, the only thing that I would add is the advantage of starting online is that as we work through the online platform, we become proficient with what instruction needs to look like, so that when that pivot occurs and we have to close something down, as Dr. Dupree mentioned, we have a learning continuity plan, if you will, because learning continues to go forward regardless of whether we have to shut a classroom down and then pivot from face-to-face to online.
Okay. All right, and so you all are managing that, and somebody's there to verify and checking lesson plans and verifying that all that's being done, correct?
Yes, ma'am.
Yes,
Okay.
ma'am. As Stephanie Houston mentioned in a portion of the presentation, we do have a monitoring protocol in place, both for face-to-face instruction and also through the online platform.
Yes, I heard that. I just wanted to reiterate it. So thank you. So, and then my last question, and I asked this question last week, and I'm going to ask it again. For those kids who refuse to sit for those hours, what is, how are we going to handle that? I mean, I've heard from a lot of parents, especially from teenagers, and I told my kid, I mean, I just use me as, for example, my kid told me it ain't happening. So of course that's going to be a battle within our home. But I heard from a lot of parents who are challenged with that, especially from their older kids, who not because it's not necessarily because the kids don't want to learn or don't want to be in school, because I think they want to interact with their fellow students. I think it's because, like I mentioned last week, we take for granted that our kids are savvy or even like computers because they're on video games. The video games and whatnot have a certain type of attention, provide a certain attention span for them, attention opportunity, whereas me sitting here in a meeting with a teacher trying to engage, that's a totally different. I mean, we know we have challenges with them in the classroom when they're in person. So for them to be online, what I'm trying to get at is, are they going to be? What's the punishment? Are we going to punish the kid? Are they going to have? What are the repercussions if we can't get them to do that, or not as well as we would like? And what are the ramifications? I want to understand that as we go into this.
Well, I'll jump into that first, and then I'll let Deanna and maybe even Joe speak to it. So the first of all, we are modifying the student code of conduct that's going to come to the board for approval in August, that will have consequences for misbehavior, absenteeism, all the things you would expect, because we believe, since we are reimagining and transforming the organization, now that we're doing so much online, we know we will do online learning even into the future. We need to look realistically at what that looks like, because behaviors might be different online. And what you're describing are some of those behaviors. So we are updating the code of conduct that will include consequences. Like with anything, we want to be careful, especially going into the beginning of the year, because we have to let students adapt. We're going to have to really rely on the social emotional components, and teachers are going to have to work really hard to engage and build those relationships. We're setting up the learning center model partly for that reason, because there's going to be some parents who know their child needs to be at a station at school learning and being supervised by somebody other than them. And so that's why we want to set up that model for more direct support for some of our kids. And I think there will come a point, if there are kids who have ongoing behavior issues and absenteeism and just lack of participation, we're going to be having those conversations with parents, just like we did if they were disruptive in a classroom, right? There's going to be ongoing campus engagement with those parents to see how we can best serve that student. And so it's just going to be part of what we do there. And part of that means, probably more than ever, to be honest, parents are going to have to parent. I mean, we're going to have to really do everything we can to bring them to the table, but they're going to have to be willing to come to the table with us, because it's one thing when you drop off the child at 7:15 and they go home at 3:30, and we have them under our watch and almost a full control all day in and out the building. But it's very different when they're at home alone or under the supervision of a parent working at home. So we're going to have to, we're setting up the systems to support it, and we have many already, but it's just going to take that true partnership more than anything. Deanna or Joe, did you want to add anything to that?
Yes, Mrs. Hilliger. So, I mean, You know, the spring was unfortunately a test run for the exact situation that you're referencing. And Dr. Dupree is correct. You know, in the spring, you know, we focused a lot on the relationships that were already established, and we relied heavily on that. Now, there was a focus on non-engagement, and we had this Department of Student Affairs that assisted campuses with really finding out the why. And I think that's at the core is, why are students not engaged? What support services can we provide as a school district? And it's really truly understanding, you know, what we can do as a school district. Now, the biggest issue that I foresee is that for many students, you know, the opportunity to build relationships with the adults, it's going to look very differently, you know, and we all know that. You know, even with some of us now, we're struggling with what does it look like to build relationships with some of the new employees that we're hiring. But just the fact that we know that it's an issue, we will be taking our time. We will be ensuring that we're supporting the campuses, obviously administration and teachers, to see what services we can provide. There's going to be a lot of conversations. There's going to be a lot of conversations, a lot of different conversations that we're used to, but we're just going to have to put in the time and the effort to see what we can do as a school district to support the students.
Yeah. So with like anything, I think any disciplinary measures that we put in place, I just want to make sure that they're equitable across the implementation of it. I mean, the policy is the policy, whatever we come up with, but it's always the implementation of that across the different schools that always has concerned me, even when we were in person. So, you know, I would definitely be concerned with that. And then and someone mentioned this about equitable learning, because this is not equitable learning for some of our students. And I think Kristen might have mentioned that earlier. Mm-hmm. And so given that perspective, we have to give the opportunities to complete work and whatnot may have to look a little differently. It cannot be the same as if they were coming to class every day, because it's not equitable. It's just not. And so, you know, I will definitely, you know, I'm very keen on what that's going to look like, especially for our students. And I, you know, I want to make sure, you know, I clarify something. I think parents are going to support us and they're going to do the best that they can. But, you know, we assume that parents are there. And you're assuming, I don't want to assume that, I don't want to assume that they're there. I don't want to assume that the parents would not be trying either. Because, I mean, my phone blew up after the last Monday's meeting around some of the conversations that we had. So, you know, when parents are working, whether it be at home or away, it's extremely difficult, you know, to manage those kids, you know, especially the teenagers. I mean, young kids, I think, are a little bit more palatable when it comes to, you know, managing and molding them. But even them, they're going to have, you know, their own challenges of, you know, attention as well. You know, how you keep little kids' attention span. A first grader, second, you know, looking at a screen and looking at a teacher all day long, right? So I'm really interested in what this policy is going to be, because I don't want it to be so punitive where our kids cannot be successful. I mean, that's really the bottom line with that, because this is a learning curve. I mean, even the 3 months or 2.5 months that we did it in spring does not equate to what we're about to do. And so even with that being said, you know, because it's not an equitable learning environment for those who do not learn in a way where they can, you know, on a computer or whatnot, I have to be mindful of that when it comes to creating any kind of disciplinary code of conduct that impacts them.
Yes, ma'am. No, absolutely. I mean, as with anything else, we look at the intent. We always look at the child's intent, you know, and we're going to consider that as well. If it is intentional non-engagement, that's a very different conversation than students who are not engaged for other reasons. But, I really appreciate the feedback. Thank you.
I do want to interject, Ms. Helliger. I think that what comes to my mind as I listen to you, and I'm going to be honest, this is the conversation we've had in the office, and I've heard it from others, is we are dealing with an impossible situation.
I know. Mm-hmm.
We are. And there are no right answers. We're all doing the best. We're doing the best we can. The parents are doing the best, and they're going to do the best they can. And so that we're going to have a lot of grace for kids because they are disrupted. So we don't want to be punitive, but it's going to mean more collaboration than ever is going to be required with parents. And, because you just wish you could set up a scenario where just drop them off and we'll take care of them, but we can't always guarantee that, because part of the disconnect, part of the challenge we're facing as an organization is this virus is affecting the very people that need us most, are the very people that are being most impacted by this virus. And there's also the greatest fear because they have personal stories, and so they're anxious. So these very families who need to be working also need and want to protect their children at home.
Mm-hmm.
So it's a real catch-22 that's very challenging.
Oh, it is. Trust me, I clearly understand this is truly an impossible situation. That's why I want to make sure, and I'm glad, and I like the word that you used was grace, because I think of it as if, we're all starting kindergarten all over again, right? Mm-hmm. Yeah. You've been at home for 4.5 years, and then you show up and now you got to be this structured classroom. You got to be able to not touch on everything. You got to walk with your hands behind your back. You got to be able to learn all these new skill sets, right? Mm-hmm. Early on in that school year as kindergartners. And so to me, that's kind of how I, look at it as well, is that we're all learning something brand new. And so we have to give ourselves enough grace, especially early on in the semester, to adapt and to work out the kinks and learn all the new rules and regulations around online learning.
Yep.
All right, that's all I have. Thank you all.
Thank you, Mrs. Helliger. Mrs. James.
Okay, well, thank you, Mr. Burdine, and thank you to everyone who did such a great presentation. I'll just pick up on where Addie was, because I think this is, as you guys were discussing that, grace came to mind. Thank you, Dr. Dupree, for mentioning that, but also just this, we have to have this long view of what we're trying to do, because we want our kids to make this fast progress in the short term, and we're hopeful that that'll happen. But because of all the built-in learning, because of all the inequities in the system, it just takes a teacher to get sick, which is no fault of the children in the class, to create in a situation where learning would slow down. So I just really feel like we have to have kind of a long view on this and realize we may go slow at points, we may be able to go quicker at points, but we can't beat ourselves up. We just have to do what we can do and somehow work that into our system and into our evaluation. And I guess it relates somewhat to the calendar we're talking about tonight. Because you guys have already said we're going to extend the professional learning time at the beginning so we can have a better start. And that's going to help us, in those first few weeks. And I think that that's true. But, if this goes on for 6 months or 9 months or a year and a half more, what does that look like for the calendar? And are we transitioning to even, I don't know, year-long school, different times off, cohorts of kids, something in there. I don't know what it looks like, but I think we just really need to be broad-minded about what it might look like and not have too many things that we feel are set, I guess is what I would say. The other thing that came to my mind when Ms. Helliger was talking was and this has to do with the calendar too, because at one point you had some like break times in there for staff and some intercessionary times for students to kind of catch up. And what made me think is, it made me think about incentives for students that are caught up or stay on track or stay online. Is there incentive in the scheduling that we can do to help them be incentivized, honestly, to keep up with it and push through? Have we talked about that at all?
I don't know that we've talked about it, but you're raising a good question, and the reality is there is, because the state will fund us for both synchronous and asynchronous. So there is a degree of opportunity to incentivize students to maybe not participate in some of the synchronous opportunities if they're doing well, and we can allow them to do asynchronous. But through the TEA guidance, we aren't going to get funded if students do not participate every day in at least one of the options. So we can't give days off and those kinds of things. They're going to be expected to participate in learning every day, but there may be some things we can do that feel like incentives and maybe provide a little time relief to some of the children who are doing well and staying on track and fully engaging. That's something we can definitely pursue.
Okay, well, thank you for considering that, and especially for having to do this for a long time, because I think we've all realized that it takes a lot of energy to do these Zoom calls and these Zoom meetings. And for whatever reason, it's a lot different than being in a face-to-face environment, and it's kind of exhausting, honestly, as we enter hour 4 of our meeting. Anyway, I like the idea of reimagining, and I want to be thinking of creative ideas, and there might be some things out there. I also think that that some of those incentives and encouragers for teachers too, and I know you guys have, I was very impressed in the presentation with all the things you've set up for success, all the monitoring, the social emotional support, all of that. It's really looks robust. It looks like you've set the teachers up for success, and I heard, I just feel really good about that, and I hope that this presentation tonight answers a lot of their questions. And did I understand correctly that as we transfer this kind of more to a campus by campus setup or planning, that teachers, if they're continuing to have questions or concerns, are going to work those out more with their home campuses than they are going to be doing, say, at the district level? Could someone speak to that, please?
Deanna, Joe, would you like to speak to that?
Yes,
No, go ahead, Ms. Savage.
No, I was just going to reinforce, Ms. James, what Dr. Dupree said earlier in the presentation. We've done a lot of work at the district level to set the guidelines, the parameters, the expectations, and provide all the tools and the professional learning that our campus principals and our teachers are going to need. As we pass the baton, after defining the what, campuses then will create their campus communities, their campus cultures, and they will continue to work on what the how might look like at their particular campus. Principals know their teachers. They work intimately with them on a day-to-day basis. And so although there may be nuances, what we've set forth at the district level will kind of set a level of consistency and in terms of implementation. But teachers can expect to interact more closely with their principals, get specific answers to their questions, as will parents, as we continue to work through the process and we get closer and closer to the launch on August 17th, should the board approve the proposed calendar this evening.
Okay, so that's great. And I saw some very rigorous schedules that were outlined, and I heard a lot about high expectations for staff as well as for students, but also for staff about, but again, providing them the support and the professional learning that they need. And I also heard clearly that we really care about our teachers, and we really want them to be successful, and we want them to be healthy. And we know that our students can't learn if the teachers are not healthy and in a place where they can teach them. I got the feeling, I really heard that you guys were really setting them up for the success, but then at the same time holding them accountable for what was going on. So I appreciate that, and I know that as part of our core beliefs and commitment statements, we want to provide a positive and safe working and learning environment for everybody, and that you guys are committed to that, and so I appreciate that. I also want to say that I was really grateful to hear from the health advisory team. And it was really eye-opening for me to hear really the severity of the situation in Fort Bend County described the way it was. And I really appreciated that. So thank you to Dr. Dupree and staff who organized them to join us. My question around that is, how are we using this team? I think you said these are part of an advisory team. How are we using this team going forward? And is there opportunity for them to come back and visit with us in another board meeting?
Absolutely. I would probably, so the way we've been using them has been primarily just to vet our work and to study our health and safety protocols. But of course, the things you heard tonight are the types of things they've been saying during the meetings all along, kind of affirming our decisions each step of the way. So everything that was talked about tonight is where we've been with staff. So we're kind of going to expand that committee a little bit as we move forward to help build the triggers, and we want them to be at the table to help develop all of that. And I would think bringing a few of them back, and maybe even some other members of the committee that we're working with, the night we communicate those, kind of that work report to the board, might be a good time to have them at the table again.
Okay, great. And I appreciate you guys developing the triggers. As Mrs. Tossan said, I think that's really key to have that worked out ahead of time. So when we go forward into our school year, we're not making emotional decisions. It's spelled out, it's lined out, it's scientific, it's under considered authority. So I really like that plan going forward. I also will bring up that the staff you talked a little bit about, or someone talked, and forgive me who it was, but you talked about staff whose roles might be changing or who might not be needed in the start of school for online. Have those people been contacted? Are they aware who they are? Do we have a process for that, or what's going on?
We're developing all that as we go. We're still determining what jobs they're going to be. But HR has got some. Gwen, do you want to speak to that? I know you've been putting a plan together to begin communicating with those individuals.
Yes, sir. We have been working with the leaders in our organization to identify the positions that may be idled this upcoming year. We compared it to last year in the spring, those positions that were idled. In the spring, we identified other ways that campus leaders might utilize some of the folks that were sitting idle, and they did use them in different ways. So we're still building out what that will look like for the fall, and working with leaders in how we might utilize them.
Okay, well, that's awesome, and I appreciate you guys working on that. I really like the idea, these people are working for us. They've already demonstrated that they enjoy working for our school district. They love students and kids, and they're all connected with us. And I like the idea of training them or retraining them and helping them to find a place where they can fit in.
Absolutely. That's our goal, Ms. James.
Good. I really like that. So thank you for working on that, and we'll look forward to hearing more about that in the future. I guess the last thing that I wanted to mention, and this may be a little bit premature, but I'll just bring it up so you guys know it's on my mind. This is related to the equity and access, the the trustees who spoke before me mentioned, we know we had some students who fell behind at the end of last year. We know we have had quite a bit of time off now, and students who may normally have been in summer school or something like that have been off. I'm concerned about figuring out where kids are and where we're trying to get them. And I'm just wondering, I think you've mentioned in the past, we're doing some initial assessing and then helping students get what they need. But are we doing that across the board, and do we have some milestones or benchmarks in place that we're looking for? And then I guess part C of this is there a midterm check-in, or are we monitoring for growth over the school year, or what does that kind of look like?
Deanna?
Melissa, you want to share some specific information? I'll kind of set you up. As you know, we have our assessment framework, Ms. James, that includes our beginning of the year, our middle of the year, and our end of the year assessment. And we want to hold true to those diagnostic assessment pieces in our framework. However, obviously, we're going to have to make some adjustments about what that might look like in an online platform as we launch the school year. So, Melissa, can you provide some specifics associated with that, please?
Sure. So one of the things that we'll be doing is we'll be moving our beginning of the year assessment window for our diagnostic assessment up so that it is close to the start of the school year so that we can get the data immediately. Typically that window, we wait for a few weeks before we launch it, but we'll be doing that immediately so we can get data on students. The other thing we'll be able to do, since we've been giving Renaissance 360 for a couple of years, is we can look at historical data at our beginning of the year for grade levels, and we can start to gauge to see if we've got a bigger gap than we have in the past per grade levels. And so that'll give us some frame of reference into the gap that we're looking at for each student. And then we will be following our assessment framework with the middle of the year assessment so that we can look at growth. And we're looking for certain indicators and benchmarks in that student growth and data. And we'll do the same at the end of the year. The nice thing about the diagnostic assessment as well is we can offer it more frequently than beginning, middle, and end of the year for some of our students if we want to get a checkpoint in between beginning of the year and middle of the year.
Okay, that sounds great. And I appreciate that, because I think, again, as if we have to make changes or pivot as we go along, or if the board needs to support staff with additional resources or whatever it might be, I just feel like having some data, from the beginning. We have what we did at the end of the year, but I feel like starting at the beginning and monitoring that as we go along will be important, because this could go on for a while, and I want to be sure that every student has a chance to reach their full potential. That's what I really want. And so if we whatever that looks like and whatever that means, and it might be a shifting of resources. So I'm aware of that, and I just wanted to bring it up. So thank you. That's the end of my questions. I appreciate everybody's hard work to get us to this point. You guys have done an amazing job. There's no doubt about it.
Thank you, Mrs. James. Mr. Rosenthal.
Yes, sir. Thank you. So I have a question. You don't need to pull this up, but on slide 29 of the display, it talks about the campus professional development, the daily schedule. And I think you said that this was prior to the start of school. But on the professional learning communities, will teachers have a chance to collaborate, not just amongst their own campus with their teachers, but perhaps across campuses? Because we may have a lot of knowledge at a couple campuses, and folks could maybe really rely and use that support, especially right now. So has that been considered?
Yes, Mr. Rosenthal, thank you for the question. When we are considering the professional learning communities, one of the reasons that we scheduled them at the same time of the day was to allow for just what you're referencing. We already have some of the central office team that works with singleton courses like our world languages, looking at organizing some of that along with fine arts and some of our other athletic areas. Working with teachers together. And then the content area department heads will also be made aware of the schedule so that they're able to collaborate as needed among those teams and using the strengths of the district.
Yeah, I think that would be great to allow that to happen. So along those same lines, as we were talking, I got a message from someone, from a parent. And obviously our curriculum is supposed to be standardized across the district. So theoretically, one school should be, pretty much on track and doing the same level of detail and rigor at other campuses. But the question was, would we allow students from different campuses to collaborate on maybe assignments or practice or projects, I should say?
Melissa, did you want to take that question? So right now, Mr. Rosenthal, we are looking at some of our courses in which maybe have small enrollment at certain campuses and trying to pull those resources together so that those kids are maybe in a class with kids at another school. And then in that respect, they would have the opportunity to collaborate with kids at different campuses. That's what we're currently looking at, some structures to put into place. We haven't looked specifically at some of our larger courses in which we have an abundance of students enrolled in particular courses at the school.
I just think, it might be just something to at least look into. Again, if it's something that will engage students better, because they get to work with their friend at the school next door or whatever. It can't hurt to look into it. So just an idea. I thought it was a pretty good idea. So the other thing, Charles, you addressed, and we talked on the phone about this, about transportation issues. It was also brought up in our earlier discussion with the medical professionals. When do you think you guys would develop a plan? Obviously, you're going to have some kind of idea on how many kids are going to be attending, which schools. And I think we would probably know that, once you do your enrollment survey. And I think we'd also have an idea based on the parent surveys that we previously did, keeping track of what's happening, with the virus. So when do you think you guys might have some type of plan, and when do you think you might be able to communicate that?
Well, I think that will tie back to the plan development that I mentioned in response to Ms. Tassan's question earlier. So the goal would be is that we have a comprehensive plan. Of course, truly we won't know how to do transportation until we do the pre-registration that we will do in the fall. And you mentioned that, but that's going to be the key driver at that point. So the goal would be is that we're able, I'm going to be real honest. We may be in a position because right now the transportation system is one of the most limiting factors we will be dealing with. Some districts are actually not providing any busing for any child except for on a very special limited need basis. And we may have to make that decision and run only a very limited number of buses, because the minute you open it broadly with social distancing, you're going to be running multiple routes for one school on any given day.
Right.
And that's just not feasible. That's not realistic.
Right. We don't have the manpower. We don't have the buses.
Mm-hmm. Yeah. So we will be putting the model, the conceptual framework together when we roll out the big picture plan and then we will execute on all of that and build out the schedules and the details when we can actually bring students back to the building.
Okay. Because it's, as I brought up last week, how many kids if you allow on a bus, especially with air conditioning turned on, you're in a closed environment. One of the things that this American Association of Pediatrics study, recommended was not using AC and weather permitting, have the AC on. So, and then you got this whole concern about, do students have to have temperature checks before they show up? Well, I was talking with another trustee over the weekend, and it's like, well, once they're on the bus, it's kind of a little too late for that. So, do the bus drivers supposed to take care of that? And what happens if the kid has a fever? Do they leave them at the corner? I mean, there's just so much to consider. So,
which is another reason we may not be able to run buses, for that exact reason.
I want people to hear and understand that,
That's right.
Again, I was so hopeful. I wanted kids to be back in schools as soon as possible, but there's just that, still, we still probably haven't thought of everything, and you guys have been doing it nonstop. So anyway, oh yeah, Grail, I actually really like your idea about the incentives, and I don't know, actually, now that I think about it, maybe allowing students to participate with friends at other schools, maybe that can be a minor incentive. But you're right, it's this is so much more difficult than being in person, because we're social animals, and it's so much easier to collaborate with people and work with people and learn, for a lot of people, for most people, not all, but when you're together. And so this is draining. I mean, having these long meetings, sitting here at my desk for 4 hours, it's draining, and it's going to be, I think, draining for students. And so I think that's something, Charles, that maybe, your next meeting with the commissioner, maybe float that out there and see if you can get some other support from some other districts to think of ways to maybe give a kid, a day off, or, half a day, or whatever, just to, as Grail said, it's kind of a reward for fighting the good fight and staying on track and being positive through all this. So anyway,
I appreciate that feedback.
Mr. Rosenthal? Did he just fall off, Dr. Dupree?
No, I think he's finished.
Okay.
No, sorry.
Okay, cool. No worries. I didn't hear you.
No problem.
Well, Dr. Dupree, that was a lot of information, and I can't thank you and your team enough for the conversation. There's a lot to digest, and I'm sure we'll have more questions in the next weeks and coming. So, thank you, staff. Thank you, Dr. Dupree. Thank you to the trustees who asked lots of great questions. I think that we've covered about all that we can cover for that information item. So we're going to move to our second information item, Dr. Dupree, our COVID-19 procurement update.
Well, the good news is there's nothing new to report. We did that in June, and there is no additional expenditures during the month to add.
Wonderful. Good deal. Well, we will now convene in closed session under the Texas Open Meetings Act, Texas Government Code Chapter 551, under the following sections for the purpose of a private consultation with the board's attorney on any or all subject matters authorized by law, to consider purchase, exchange, lease, or value of real property, personnel matters, security matters, student discipline matter or complaint, personally identifiable information about public school students. We are now convened in closed session. This evening is to consider action on closed session items. We do not have any actions to consider from closed session this evening. So we're going to move along to 10A, which is to consider approval of creating a board equity committee, district equity oversight committee, a board development plan on equity, and a district equity audit.
Mr. Burdine,
Yes, ma'am.
I move the board create a board equity committee that will first develop and recommend to the board a working definition of equity to guide the board's work. And the board will initiate a district equity audit, initiate creation of a board development plan on equity. It will be informed by the board equity committee recommendation to the board, and then create a district equity oversight committee.
Second.
We have a motion by Mrs. James and a second by Mrs. Tossan. Do we have any discussion? Hearing none, I will call the roll so each member can state his or her vote on this item. Please state your name and then vote yay or nay. We're going to start with Mrs. Drew.
Allison Drew, yay.
Mrs. Addie Helliger.
Addie Helliger, yay.
Mrs. Grail James.
This is Grail James. I vote yay.
Mr. Jim Rice.
Jim Rice votes aye, yes.
Yes. Mr. Dave Rosenthal.
Dave Rosenthal, yes.
Mrs. Kristen Tossan.
This is Kristen Tossan. I vote yes.
And this is Jason Burdine. I also vote yes. All right. Thank you, board. We're going to now move along to our board member report. First is our activity report. Mr. Rosenthal.
Yes, sir. For July, we had a virtual 2020 TASB Summer Leadership Institute, Fort Bend Chamber of Commerce 2020 State of Higher Education Zoom meeting, calendar committee meeting, special called meeting, regular business meeting, town hall Zoom meetings on opioids, dangers and risks, superintendent of the year, selection for Region 4, live check-in with Charles event, Gulf Coast annual meeting, City of Sugar Land COVID-19 response presentation. That is it.
Thank you, Mr. Rosenthal. We appreciate your report. Next is our special report. So Mrs. James, will you give us your report on Go Public Gulf Coast, please?
Yes, thank you, Mr. Burdine. So last week I attended the annual meeting for Go Public Gulf Coast. I attended virtually. I was held via Zoom. I was glad to be there because I was the only one from Fort Bend County, so that was good. The marketing person that Go Public Gulf Coast has engaged kind of gave us an update as to what media buys they've done over the past year. And one of the most interesting things is that they've done a media buy on ESPN radio here in Houston, and that the announcer that did it was a Clements High School graduate and did that in sort of the off ad lib part of his advertisement. So that was pretty good and good for our district. We did all the efforts have really been to drive people to the Go Public website, and there's a lot of information about COVID-19 on there, and so that's been interesting. The other big item of business was merging with Bexar County, potentially merging the organizations, merging the brands, and establishing one website and moving forward. They seem to indicate that they'd be collecting dues and collecting money, and that money would be staying in the region for additional media buys. But exactly the logistics of that and how that would work in the 501c3, there was a number of unresolved issues with regard to that. I've been serving as the vice president on the steering committee, and I've stepped down from that role and exited the steering committee to allow some new people to join. 2 new people were added last week. One was John Haskew, who lives in our community, and he's an architect for Huckabee. And the other was Ann Hammond. She's a former trustee in Clear Creek ISD. She has a huge passion for public schools, and I think will serve well as a community representative on the steering committee. Bob Covey will probably remain from Sci-Fair, will remain as president of the organization of the steering committee. And it's possible that the 2 new steering committee members will be officers. The steering committee will be working that out amongst themselves. The current bank balance for Go Public Gulf Coast is right at $19,000. And they're saying that the marketing director, Lisa Jackson, I think is her name, will be sending out the invoices to different districts for next year's dues. And that concludes my report.
Thank you, Mrs. James. Thanks for serving in that role and representing Fort Bend ISD. We appreciate you. Next is our consent agenda. May I have a motion?
Mr. Burdine, I move to approve the consent agenda in its entirety.
Second.
We have a motion by Mr. Rice and a second by Mrs. James. Do we have any discussion? Hearing none, we will now vote. Please state your name and vote yay or nay. Mrs. Allison Drew.
Allison Drew, yay.
Mrs. Addie Helliger.
Addie Helliger, yay.
Mrs. Grail James.
Grail James, aye.
Mr. Jim Rice.
Jim Rice, yay.
Mr. Dave Rosenthal.
Dave Rosenthal, yay.
Mrs. Kristen Tossan.
Kristen Tossan, yay.
And Mr. Jason Burdine also votes yay. Motion passes. Next on our agenda is an action item, and I'm going to let Mr. Jim Rice lead us through this. This is to consider our endorsement of a candidate to represent Region 4, Position B as a director of the Texas Association of School Board of Directors. Go ahead, Mr. Rice.
Thank you, Mr. Burdine. I can't seem to bring up my agenda while I'm in Zoom.
Okay.
But I will. Who is I know it's Paige, and then what's the lady from A-Leaf?
Paige Rander, and then and Darlene Bro.
Okay. So just to give you some information, both Paige Rander and Darlene Bro are asking for an endorsement of their candidacy. They will be, they will be appearing before the nominating committee in September, and one of them will be recommended by the nominating committee and placed on the ballot for voting on at the delegate assembly. So I have been working with Paige Rander for quite a while. Paige is with Clear Creek and has served on the TASB Legislative Advisory Committee for several years. I think Grail may have served on that with her. And Paige was appointed, she's currently on the board of directors. She was appointed in December to fill the unexpired term of Charles Cunningham, who was formerly of Humble ISD. Charles was invited to be appointed to the City of Humble City Council, which he accepted, but that meant he had to step down as a trustee from Humble ISD, also as a TASB director. He was a TASB officer, actually. Paige Rander was selected by the nominating committee to fill the unexpired term of Charles Cunningham. So she is now running for a full term in her own right, a full term of 3 years. I'm sure Darlene Bro with A-Leaf, I just don't happen to know her. But I would, I know Paige, she's already on the board, and it's my recommendation that we support Paige Rander.
Thank you, Mr. Rice. So how can we put this in a form to vote?
I move we support Paige Rander for Region 4, Position B, Director of the Texas Association of School Boards, Board of Directors.
Second.
Thank you, Mrs. James. We have a motion by Mrs. James and a second by Mrs. Tossan. Do we have any discussion?
I just will say, I agree with Mr. Rice. I know Paige and have worked with her on the Legislative Advisory Committee. She's very well spoken, and she cares a lot about students and school districts. So I think she'd be a good selection.
Agreed, Mrs. James. Thank you for your comment. All right, we will now vote via roll call. I will call your name. Please state your name clearly and vote yea or nay. Mrs. Allison Drew.
Allison Drew, I'm going with yay.
Mrs. Addie Helliger.
Addie Helliger, yay.
Mrs. Grail James.
This is Grail James, yay.
Mr. Jim Rice.
Jim Rice, yay.
Mr. Dave Rosenthal.
Dave Rosenthal, yay.
Mrs. Kristen Tossan.
Kristen Tossan, yay.
And Mr. Jason Burdine also votes yay. This motion passes. Moving along to consider our approval of the revisions to the 2021 school year calendar. May I have a motion?
Mr. Burdine, I move to approve the action item as presented.
Second.
We have a motion by Mr. Rice and a second by Mrs. James. Do we have any discussion?
I have a question.
Go ahead, Mrs. James.
I've forgotten, I think you answered this already, Dr. Dupree, or maybe Mrs. Williams did, but is this what we're sticking with for the first semester? And then we might revise it again in the fall for the second semester?
I think there's flexibility, but yes, I think at the longest it would be the first semester, but depending on how conditions develop, we could be back in September or October, maybe even modifying some calendar dates in October and beyond, because we do want to make sure we're meeting the needs of our teachers and students to provide breaks. And we're going to have to look seriously at the intervention schedule that was provided in the intersession parts of the calendar. So we want to do it sooner than later, but we want to get some history under our belt before we come back to the board.
Okay, well, that sounds good, because I agree that this might be a calendar that it gets us started, I guess, but I do feel like we should be considering all sorts of creative ideas about the calendar going forward. Mm-hmm. My second question has to do with the Thanksgiving break. I noticed a couple of those days are marked as professional development days, and I think someone spoke to it, but I can't remember exactly what you said. Are the teachers supposed to be present in some type of professional development during the beginning of Thanksgiving week?
No, ma'am. So the only teachers that would be asked to work would be those who have not completed their PD. That is kind of a floating PD that they do on their schedule, but they get paid 2 contract days to complete it. So they do have to invest a flexible floating time throughout the summer and throughout the fall to complete it. So those are days in the calendar that represent that. And they're basically opt-out days that if they're all done with their PD, then they get the whole week off. It's a common practice. It's something we haven't done in a long time in this district, but it's a common practice in many other districts. That works well.
Okay, well, that sounds great. And so long as whatever the PD is, it doesn't need to be synchronous. It can be asynchronous.
That's correct.
See, I'm a quick study on this stuff.
You are.
Okay, thank you then. I'm supportive of the calendar as it's presented.
Thank you, Mrs. James. With that being said, I will now call roll so each member can state.
Rosenthal has a question.
I'm sorry, Mr. Rosenthal. Go ahead, sir.
Yeah, I agree with Grail on this. I think, kind of as I mentioned last week, I think it's a good idea to see how things go, and rather than set a schedule for the whole year like that, knowing that we haven't thought of everything. And so there are going to be changes, I'm sure, because there'll be issues that come up, and yeah, that will require changes. And the only concern that I saw there is, the pretty long gap between days off, which I think you addressed already, Charles. But was there any other pushback that you got?
Stephanie, have you heard any other feedback?
No, we floated the calendar to the calendar committee, and they were supportive of this as an interim measure. They did have feedback about that, but they hadn't yet seen the teacher schedules. And so I know many of them tuned in tonight to that. So there was high level of support
there. Okay.
Thank you, Mr. Rosenthal. Anyone else have a question or comment? I can't see everyone on my screen, so speak up if you do. All right. Thank you, staff and Dr. Dupree, for all your work on this. We will now vote. Please state your name and vote yay or nay. Mrs. Allison Drew.
Allison Drew, yay.
Mrs. Addie Helliger.
Addie Helliger, yay.
Mrs. Grail James.
This is Grail James, yay.
Mr. Jim Rice.
Jim Rice, yay.
Mr. Dave Rosenthal.
Dave Rosenthal, yay.
Mrs. Kristen Tossan.
Kristen Tossan, yay.
And this is Jason Burdine, and I also vote yay. This motion passes. Next on our agenda is to review our future board meeting agenda items. Dr. Dupree.
Okay, let me see if I can get there. Sorry. So basically, in August, we're going to give an update on COVID-19.
Really?
What a surprise.
I'm sorry.
And the board's going to consider which of you get to represent us at the TASB Conference Delegate Assembly. So that'll be an important work. Other than that, we're looking out to September to do other work. We're going to do there was no accountability this year or STAR, but we are going to do a student achievement report. So we're going to do kind of a student academic progress and achievement report in September. We're also going to need to do at some point in September or October our annual CTE and college and career readiness report. So we'll have that on the schedule. There in the process of putting that together now, along with an internal audit report on child nutrition. In August, we are going to add the internal audit report that was scheduled for tonight that we've moved out on the facilities management audit. But other than that, I know you're ready to go home and I'm ready to go to bed.
Addie,
I move that we adjourn this meeting.
This meeting is now adjourned. Great meeting this evening, everyone. Thank you, staff. Thank you, trustees.